Hi, we're back. Wasn't that super quick? Look at us go. Yeah.
We over-delivered on our promise, less than 60 seconds.
We won't fire tech support after all. Yeah. So we're back, and we are back with the next story and some more celebrities, and then we'll see you in a little bit.
Hey, it's Jeremy Piven here. April is Global Congenital Diaphragmatic Hernia Awareness Month. Okay. And first of all, we need to make t-shirts because we need to all know more about that. I had no clue. CDH International encourages people to participate in fundraising and raising awareness, and they're doing a great job, and they're sharing stories, and it'd be great if you guys donated to this telethon. CDHI.org. A really great one. We all got to breathe from our diaphragm. We have to breathe deeply. One of the biggest problems is shallow breathing. We must breathe from our diaphragms. You all did see that on Lupercal, I thrice presented him with a kingly crown. You know what I'm saying? Think about that. Have a brilliant year, everybody.
Yo, what's up? It's your friendly neighborhood Coolio with a message. Remember this, April 19th is Congenital Diaphragmatic Hernia Awareness Day. Over 52,000 children are born with CDH every year. Only 50% survive, and the cause is unknown. Please help CDH International to fight this horrific birth defect. Donate at cdhi.org. That's cdhi.org to help stop congenital diaphragmatic hernias. Peace and Shaka Zulu.
Yeah, my name is Kimberly Spriggs, and me and my husband are from Maryland. And we're currently relocated to Philadelphia. We're at CHOP.
Okay. Tell me a little bit about what life was like before you heard the word CDH.
Well, life was actually, it was great. We certainly, we were on our journey to, becoming parents. And when me and my husband met, we were together maybe 6 months, and we found out that we were expecting. We had known each other for a very short time. We found out it was a little girl, and just one day I started having some issues, and we unfortunately miscarried her at about, I believe it was about 16 or 17 weeks. So we were kind of like almost halfway, I guess. We don't know what happened, but we miscarried her. And then after that, we decided to, trying to recover from that and take a little break and not try again. We actually ended up getting pregnant 2 more times after her. And those were like early losses. They were like chemical pregnancies. So we suffered that as well. We ended up getting pregnant again in 2018. That was the first time that we actually heard about CDH. We went to our 12-week scan with him, with that pregnancy, and that was the first time we heard about CDH. We had never heard about it before, didn't know anything. We went into, we were kind of like, we were excited about that pregnancy after what we went through before,
right,
with our other losses. And it was just so much information and a lot to take in. But yeah, that was the first time we heard about CDH. Prior to that, I didn't know it was a thing. I didn't know anything about it. Yeah.
Right. And what happened to that pregnancy? Did you guys continue that pregnancy?
Oh my gosh. It was rough. We found out about the CDH very early on, much earlier than we found out with Ollie. It was our 12-week appointment. you know, and it was just, we didn't know what to do. Like I said, we never heard about it before. During that pregnancy, we were never told about other options. Didn't hear about CDH International. We didn't hear about all these other CDH babies. We didn't hear about CHOP. We didn't hear about all these other hospitals that this is what they deal with, you know, daily. You know, the hospital, All Children's in Florida. We didn't hear about any of that. And they told us that it was, you know, pretty bad. He had, it was the same as Ollie, actually, left-sided CDH, and it was severe, from what they could see on, you know, the scans and everything. And they said, they kind of pushed us to terminate. And it was just like a whirlwind of like so many emotions and not knowing what to do. Like, should we carry on with the pregnancy, not knowing what he's going to go through? It was a little boy, just like Ollie. And they said, you guys have time to think about what you want to do. And we took about a month or so and thought about all the options that we were given, which weren't many. They kind of like I said, really pushed, you know, ending the pregnancy. And that's what we did.
Yeah, I can't even imagine what's the feelings and the decisions around that.
It was really, really hard. Like, we took I would say it was about a month that we took to decide, you know, what is the right thing to do. And I think the whole time during that, you know, thinking process that we were, you know, me and my husband going back and forth, like, I mean, we weren't given much information. We weren't told like what, you know, we took about a month to decide if we wanted to terminate, and we did. We thought that it would be best for him to not have to go through what, you know, he would have gone through.
Right.
Yeah, and I try not to talk about it, but it was really hard.
I can't even imagine what you've went through. And then fast forward to hear about Ollie. How far along were you in your, oh, you're fine. How far along in your pregnancy with Ollie when he was diagnosed?
Oh, and I just want to say real quick, our little boy that we lost, his name was Dominic. We named him. And we actually named all of them that we lost. We gave them names. But yeah, we found out with our last one at 12 weeks. It was actually much further along. We found out with Ollie at 20 weeks.
So was CDH on your guys' minds when you guys went into your appointments? Were you asking about CDH at that point?
With our last, with Dominic, we actually, they told us that if you guys get pregnant again, it's a 1% chance. And we were like, okay, that's such slim chances of it happening again. So we went into, when we found out we were pregnant with Ollie, we were excited. You know, nervous too because of everything we've been through. But we were like, we only have that 1% chance. So I think we're going to be okay. And we were that 1%, or he was the 1%. We found out at 20 weeks. And we went into that appointment. I mean, my husband especially, I'm always like I'm more of the negative one. My husband is always the positive one. And he was like, everything will be fine. You know, and that was the first appointment he was able to go to with me because of COVID. All the appointments leading up to the 20-week appointment with Ollie, I went by myself. Oh. And that was the only one that he could go to because it was an important appointment.
Right.
So yeah, that it was in the back of my mind. I'm sure it was in the back of his, but we were like, we're not going to be the 1%. We'll be fine. Everything will be good. And we were really hoping it would be. So
yeah. How did they tell you during the appointment? Was it something that was really obvious?
I think it was pretty obvious because when they started the scan, the nurse or the tech that was doing it, I think if I remember correctly, she like saw something pretty quickly. And then she went to get the doctor, and the doctor came in and did the scan again. And we went on from there. You know, And we had actually, they knew that our previous was, or had CDH, you know, that was in my record. So I think they pretty much knew what it was, and they referred us to, that was the first time that, you know, they actually, I mean, this was a different practice I was going to from the one I went to before, but, you know, they told us about CHOP, and I'm so glad they did, and didn't just kind of like what we went through before, and we didn't have any information.
Right.
So.
And how far is CHOP from where you guys are located there in Maryland?
A little bit more than an hour, maybe
more.
like an hour and 10 minutes.
Okay.
So not real far.
No. So how did your rest of your pregnancy go? Did you have any complications, or did it go smooth sailing?
I was sick for about 2 months, which I had been sick with all my other ones because I expected that. I knew that was going to happen. I was hoping it wouldn't, but it did. But after the 2 months of being really, really sick, like I literally couldn't eat or drink anything. It was rough. But after 2 months, like besides dealing with the news that he had CDH, like it went, I mean, I had to pee every 5 seconds. As soon as I got in the car, we would go somewhere. Oh, gotta use the bathroom.
Right.
Use the house. Besides the typical pregnancy stuff, being hungry all the time, after being so sick for 2 months, it went really well. And, you know, I had never gotten that far. Well, I got to 20 weeks with Dominic. And that's when we went through the process of, you know, doing what we did. So I was pretty far along with him. I mean, I found out at 20 weeks with Ollie about the CDH, but you know, that was with Ollie, obviously, that was the furthest that I have ever gotten with any pregnancy. So it was really cool to feel him kick and all those awesome things that the really good things that you go through with pregnancy.
Right.
You know, feeling him and feeling him move and sitting on my bladder.
Right.
Yeah. After, you know, once I got further into the pregnancy, it was great. It really was.
That's good. And then
I miss my belly.
Oh yes, he was safe inside there.
Yeah.
Oh.
So
tell me, did they plan an induction? Was the C-section, or were they going to let him come naturally? What was the plan there with you guys being an hour or so away?
Yeah, so they wanted, so when we started our appointments at CHOP, we started back in, I believe it was December, or I'm sorry, I think it was December, early December. We went to our first appointment at CHOP. It was the longest day ever. We started at like 8 a.m. We didn't get out of there until like 5 or 6.
Wow.
We literally saw everybody. We met with, you know, I had an MRI, I had, you know, multiple scans, a whole bunch of stuff. Their whole process for, you know, CDH baby. So they said that the whole time I was pregnant with him, up until maybe like a month before he was actually due, he was breached. So they said that if he continued to stay breached, that they would schedule a C-section. But they were hoping that he would turn around and then I could have a regular delivery. But every appointment that I had with them up until delivery, you know, he stayed, well, up until close to delivery, he stayed breached. But then one of our last appointments that I went to where I had an ultrasound, the tech came in and he was still breached. Soon as she walked out the door, we were talking about it. We were like, we hope he turns around. You know, we don't want him to stay breached. You know, I would like to have a regular, you know, delivery. And soon as she walked out the door, I felt like the biggest like movement or kick.
Oh no.
And he flipped himself and he was not breached anymore.
Oh.
It was really cool. And when the tech came back in, we were like, well, I just felt something really big. And then she went and checked, she did another ultrasound and he was turned around the right way. It was really cool.
Yeah,
so I think he was listening to us.
Right?
But ultimately, I ended up having a C-section. I started having labor about 2:30 in the morning on April the 6th.
How far along were you?
38 weeks.
38 weeks.
That was pretty, I was almost full term.
Mm-hmm.
Thank goodness. You know, that was a worry of mine because, you know, they go in and check your, like, you know, your fluid and everything. And it was like kind of high, but not really bad. Not like a high number. So they kept thinking that, that I was going to deliver early or have him early. And I was like, no, he's got to stay in there because we wanted him to be as far along as possible.
Right.
Because of his, you know, what he would have to go through once we had him.
Right.
So I started going into labor 2:30 on April 6th, and then we went over to CHOP. We were staying at the Ronald McDonald House here in Philly. So we're literally 5 minutes away. So they told us to come in. And when I got there, I was 3 centimeters dilated. And yeah, it started the whole process.
Yeah.
Yeah.
So tell me, you've arrived to the hospital. What are you thinking, knowing that his journey is about ready to start?
I honestly, I mean, I was really nervous, but I was excited I was nervous for what was to come because I didn't know what to expect. They try to prepare you as much as possible, but really, and I know that more now than ever, is they can't prepare you enough for what you see and what you go through, because every baby's different. I feel like, you know, no 2 babies are the same when it comes to CDH. Somebody could go home at 3 months, somebody can go home at a year. We're almost at a year. And I've seen other CDH babies that I follow, they go home at 3 months.
Right.
So they're all different.
They are.
I was excited to meet him.
Yeah.
You know, going through everything else we went through previously, like we were going to meet our baby and see him. We never got to do that with anything else, with the other ones. So I was really nervous, but I was excited too.
So what led to the C-section? What happened that prompted that?
So all day on April 7th, you know, they tried to like help me move forward with, you know, be dilated and, you know, get further along in the process. And it just wasn't really moved. Like, I think I got to 6 centimeters and they were like, okay, I think we need to, you know, do the C-section. They had brought it up before, you know, they talked to us, you know, you guys may end up needing that. And, you know, especially since he had been breached the whole time pretty much. So we were prepared for it. That's one thing I kind of regret is not doing research on a C-section, because obviously I never had one before. I didn't know what to expect. Like they told us you guys may have one. But I never did research on it. I think I was so busy looking up stuff about CDH that I never, you know, looked into really what happens when you have a C-section.
Right.
But yeah, so I got to 6 centimeters and they were like, we need to just move along. And I think we're going to go ahead and schedule you for a C-section. And at that point, it moved pretty quickly. I think within about an hour, they had us scheduled for the OR, and we were ready to go. And it was about 7:30, and then they got started. It took a little bit for them to get him out. I think he was like tucked somewhere. He didn't want to come out. He wanted to stay in there.
Right.
I wanted him to stay in there as long as possible.
So your husband was there with you, even with
yes.
COVID, he was able to be there?
Oh my gosh, yes. Yeah, he went with me. He took me over to the hospital at 2:30 in the morning. He stayed the whole time.
That's great.
Yeah, it was. I don't think if he wasn't there, I don't even know.
Right.
Yeah. So they got us all ready for the C-section, and then they were finally able to, you know, pull him out, and we didn't get to see him. I didn't get to see him at all. You know, they pretty much took him right away. because they knew that, you know, what their process would be is to get him, you know, hopefully intubated, which they did. Got him all, you know, settled and everything. He was intubated, had a whole bunch of IVs and lines hooked up to him. My husband actually, while they were finishing up with me, which took forever, you know, to close me up and everything, it took so long. They were having some issues with that, with me. But my husband was, once they got Ollie to a room down in the NICU, he was able to go down and take some pictures. So it was, and then he came up and showed me, and against advice, medical advice, they said, you have to rest, you have to stay in bed. I went down maybe an hour later and saw him. I'm like, I have to see him.
Right.
So yeah. And we, you know, we have, I don't know if you've ever seen him on Facebook, but we have pictures of when he was first, you know, born and everything. And everything was hooked up to him. And after about 4 hours, they decided that he needed ECMO. So he was hooked up to that 4 hours later. He was only 4 hours old. And that started our journey.
Right.
Yeah.
So how long was he on ECMO?
He was on ECMO for 27 days.
27 days.
Yes.
And then during that time frame, did he have his repair surgery while he was on ECMO?
Yeah, it's something that they didn't want to do. They say that they prefer not to do any surgeries because of bleeding and other things while on ECMO, but he had his repair on day 20 and then was taken off ECMO a week later. So yes.
Did he have any other complications on ECMO? Any bleeding or clots? Did anything come up?
He never had any clots. I know that, and this was after he ended up needing some like transfusions and stuff. But when he was on ECMO, he actually did pretty well. I have this journal that I have kept track of everything that has gone on with Ollie. I don't have it with me right now, but if I remember correctly, he never had any real issues on ECMO.
That's good. He's a strong little guy.
Oh my gosh, he's so strong. So yeah, they did his repair on day 20. They took him off of ECMO on April 20th or day 27. It was April 27th. And then he did good with the repair surgery. They weren't able to close him up all the way and put everything back in where, well, the only thing they couldn't get back in where it needed to go was his bowel. So they ended up putting a silo over his opening and enclosing the bowel in this silo. It looked like a plastic grocery bag.
Right.
I've never seen anything like that. So they had his bowel in the silo to allow more room in his belly. And then once there was more room, they were able to put that back in and close him up completely.
How long did that process did that take?
I believe it was about a week and a half, 2 weeks, roughly. And then after that, you know, he really began like the healing process and just recovery, which, you know, his recovery was pretty rough. He had issues with not the patch itself that they used for the repair, but like he would get fluid around the patch. The patch is, you know, from the scans and everything they did, they always said the patch was good and in good condition. They used like a mesh patch, not a biological patch. And then, but there was always like three times in a row, there was fluid that was collecting around the patch and it was infected fluid. So he got sick, really sick. 3 times we dealt with that. He had to have, you know, IR, interventional radiology, come and put chest tube. He had 2 or 3 chest tubes to help get the fluid out, to drain some of that. And that seemed to work. But they had to do it 2 or 3 times.
Mhm.
Because the fluid will go away and then it will come back. And like the entire time he was on antibiotics. He was on antibiotics for a long time.
Right, I remember.
We were finally able to get him off the antibiotics, which was scary because I was like, well, what if we take him off and then he gets sick again? And he's
Mhm.
doing so well. But when they ultimately did stop the antibiotics, he hasn't had any issues since then.
That's good.
But he had 3 infections around his patch. He was on so much medication at one point, sedation and pain medication, that he became like delirious. And they had to treat that.
Mhm.
It was really crazy.
Oh, I can't even imagine.
Yeah.
So when was the first time that you got to hold Ollie? Was he still on the ventilator?
Yes. So he was off ECMO. We wouldn't have been able to hold him while he was on ECMO.
Right.
But once he came off of ECMO, we held him when he was 37 days old.
37 days.
Yeah, so a little bit more than a month, we were able to hold him. He was still intubated. He was still on the ventilator. He was on the ventilator for 4 months. But the first night that we held him, it was actually Mother's Day weekend.
Oh,
That was really cool.
That
Yeah.
was. I'm sure you didn't want to give him back to the nurses
No.
either. Or even share with your husband.
No. And actually, I let my husband hold him first.
Oh,
I was like, you can hold him first.
yeah.
It was really, really cool. Just we never got to hold our baby before, so it was like
Very special for you guys.
Yeah, it was really, really cool. And he was so cute.
Oh, he is a cutie, that is for sure.
Oh, thank you.
So tell us a little bit about how long it took him to get off the ventilator. Was there days that you had to put him back on, or how did that process go?
So he was on the excuse me, he was intubated for 4 months, and they decided I believe it was the middle of August, they said we're gonna extubate him. They had talked about it for a while, and they were just waiting for the best opportunity for him to go ahead and do it. They were like, we're gonna extubate him, and then we're gonna put him on BiPAP. And we have a couple different masks we can try when we switch him to BiPAP. They have like the full face one, they have the mouth and nose one, and then we're gonna see which one he liked more. He didn't like any of them. He hated the full face mask. It was like a scuba mask.
Right.
Oh my gosh, he hated that one.
Oh.
But anyway, they extubated. It went well. It was really cool to see like him without that tube in his mouth. It was, yeah. So that was really cool. And then he did pretty well for the first couple days. Going into about day 3 and 4, he started to work really hard with his breathing and not look so great. And by day 5, we were like, this isn't working. He's working way too hard, and we didn't want to set him back.
Right.
We didn't want to go backwards. We were trying to move forward.
Right.
So we decided to re-intubate him and let him rest. So, and then we tried again about a month later, and then that time was successful. We were able to get him on BiPAP, and he did really well.
That's good.
But during that whole process, when they extubated the first time, they had stopped one of his pulmonary hypertension meds. They had weaned him from that, and he was on 2 others. But his one Remodulin, they had weaned, and he was off of it. And we're not really sure. We know it helps him, but with him coming off the Remodulin, being extubated, like it was a lot all at once. We feel like.
Right.
So, we kind of felt like that was not in his favor to do that all at the same time. So, but we were they actually restarted him on that other medication. And then they, after re-intubating him again, and then we were able to extubate about a month later, and he's done well ever since.
And he's still on like a CPAP. Is that what he's on now?
So they activated him to BiPAP, pretty high settings. And then they were able to wean down from that. He got to, a decent setting with his BiPAP. And then just about a week ago, he was put on CPAP. And that was the first time they've done that. And he's doing great with that. And they've been able to keep they have like a RAM cannula. It's like a bigger cannula that's just in his nose. So he doesn't even have the mask anymore.
Okay. Is he
Still
happier with not having that mask?
Oh my gosh. So much freedom.
Right.
So I think he's pretty happy with that.
And he's still on several medications for his pulmonary hypertension, or just the one?
He's on 3.
On 3.
So they had restarted the Remodulin back after they extubated the first time. So he's on 3 of those. 2 oral medications and 1 is sub-Q, so it goes right into his through a pump. And it's in his leg.
Okay.
So, and he's on other medications as well. He's on a medication for his reflux. He has reflux pretty bad.
So tell us a little bit about his feeding. Did he have feeding struggles, or how has that journey been with feeding?
Yeah, so he's been on continuous feeds for a long, pretty much the whole time. I mean, back in the beginning, he was just on the TPN and lipids, but then we got him to a point where he could start the formula, and he's been on continuous formula. They just recently, probably about a month ago, they were stopping his feeds in the evening from 6 to 10. So he has a little bit of a break because he's been on continuous the whole time, 24 hours a day. So, and he's done really well with that.
That's good.
So he's on a Gerber formula that's formulated, it's like a gentle formula. So because his reflux is pretty bad, like I said, and he does really well with that. The only other thing that he has a speech therapist that comes to see him. He has speech PT and OT that see him throughout the weeks. And she's let him taste different baby foods. And he loves the bananas.
Yeah.
He loves the bananas. So we've done little tasting of things here or there, but as far as his feeding and stuff, that's pretty much it.
So do they plan on just continuing those continuous feeds, or do they plan on trying to see if he will take a sippy cup or a bottle, or?
We've never done any of that. I'm sure, we've talked about a little bit here or there, what we could do when we get home. His speech therapist says that we can try the different baby foods and stuff when we get home, stuff that's a smooth texture, that we could start with. And then I think that's something that we're going to really work with once he's home, and start incorporating, whether it's a bottle or sippy cup or whatever.
Right.
We haven't done much of that while he's been at the hospital, though.
Right, and still being hooked up to the BiPAP and then the CPAP. They probably want him on a lower support before they start.
A lot of it has to do with the respiratory support that he's on and has been on before they go into all of that. Yeah.
Right. And I've been seeing your videos and pictures that you've posted, and we see them working hard with OT and PT and speech.
Oh my gosh.
The other day you posted a video of him on his little swing and him looking like he wanted to get his swing going, himself. Yes. He's a very intelligent little boy.
He's so smart, and he has come so far. It's crazy.
So what are your goals that you have to meet before you can take him home?
We honestly, we continue to meet our goals with him. He's doing so well with everything. I know they want to kind of tweak his respiratory support a little bit, which we might see them do in the next week or so. But outside of that, as far as me and my husband go, we've done all of our training. We've done everything. Ollie continues to do everything. And as I've been saying, our holdup is nursing. they haven't expressed that there's much else to do as far as Ollie goes before we can go home. So it's just finding that nursing.
And how much nursing are they wanting you guys to have at home?
So they want us to start with 20 hours for 2 weeks, 20 hours a day for 2 weeks. And then we can cut it down from there to probably about 16 hours for 6 months. Yeah.
Mm-hmm.
So.
And is it just mainly for respiratory support? Is that their biggest concern?
He does have a GJ tube, which he got, a couple months ago. But, we've been trained in all of that. I guess, there could be issues that arise with that.
Mm-hmm.
We were trained in all of that though. But yeah, the main thing I think is his respiratory support and just to make sure that he's safe. So they're kind of basing us needing nursing on if something were to happen.
Okay.
If that makes sense.
Mm-hmm.
So hopefully nothing will happen, but if something does, they want nursing there.
Right.
So, yeah.
You guys would be farther away from the Children's Hospital. Is that, you have one there in Maryland close by to you?
So there's one that's a little bit closer. It's in Delaware. I think it's called, it's AI DuPont. We have a small local hospital, they would be able to get him stable, but that, stable enough for a transfer. Because, if something were to happen, I would want him to come back to CHOP.
Right.
So yeah.
Right. So what do your days look like? Are you spending your time with Ollie every day, almost 24/7, or just leave to take a nap? Or
I'm not doing 24 hours anymore. Oh my gosh. When I used to go there a few months back and I was there all day long, from 8 or 9 a.m. until 7 or whatever, 7 at night. I had so many people tell me, you have to take a break. You have to leave, and you have to take care of yourself.
right.
It took me a while to accept that and do that. So now I typically go just in the afternoons for between 5 to 7 hours.
Mm-hmm.
I'm not going, and when I was going really early, it's when he wasn't doing well, And
Are you guys still staying at the Ronald McDonald House?
Yep, we've been here since the beginning. So yeah, we're still here.
Does your husband have to commute back home, or is he able to work there?
He actually works from here.
That's nice.
He's been remote since the start of COVID. Okay. So they haven't made him go back yet, and hopefully they won't.
So with COVID restrictions, was CHOP allowing you both to be back with him, or did you guys have to take turns?
No, the whole time we have been able to be back there with Ollie in his room. They sort of changed the policy a couple months back when COVID was just starting to get better. And my mom and my husband's mom have been able to see Ollie and come visit him.
Oh.
So that was really cool. But then once COVID started to go up again and get a little bit worse, they changed their policy as the same here at the Ronald McDonald House. There's no visitors.
Mm-hmm.
But the whole time, me and my husband have been able to be there with Ollie and see him every day.
That's good.
Yeah.
That's very good. So tell me, I read a little bit that he said his first word just recently.
Oh my gosh. Yeah, I have it recorded. It was perfect timing. But he said hi.
Oh.
A couple days ago, and he said it twice.
That's cool.
And yeah, like I said, I was able to record it once, so it was really cool. I couldn't believe it.
Right.
I was like, what? Yeah. Me and the nurse that he had that day, I was there visiting him, and we just kept saying hi over and over and over again. And he said it.
Yeah.
So it was really cool.
Yeah, it is. Very cool.
Yeah.
So is there anything else you would like to share about Ollie's journey?
Just that he is one strong baby. He has been through so much, And, you know, just when we go back and look at pictures from the very beginning and seeing how far he has come, and, you know, I really do believe that, you know, if it wasn't for CHOP, then, you know, I don't think he would be here. You know, we had some scary moments, where you know, there was one occasion, just really quickly, that, you know, we had a family meeting a few months back, and the doctor said, if he doesn't get better, there's nothing else we can do. You know, he was at the max of all medications, pain, sedation, whatever it was, there was nothing else they could do. And I remember, you know, being in that family meeting and crying so hard, you know, when the doctor said that. And, you know, all I have ever wanted was a baby. And for somebody to tell me there's nothing else they can do, you know, I'll admit that I lost it. I was so upset. And then, like, literally the next day or the day after, Ollie started getting better. I prayed so hard. I mean, I prayed this entire journey,
Right.
but in that specific moment when he was not well, like, I prayed so hard. And, you know, if it wasn't for CHOP and God, I don't think he would not be here.
Right.
So
He is a strong little boy.
So strong. And so are,
and he still has a smile through everything. You know, he still smiles.
Yeah, you would look at, I feel like if you look at him now, like, you would never know, if you didn't see his scar or if you didn't see anything else on him, you would not know what he's been through.
Right.
So yeah, he's so strong.
He is very strong.
Yeah.
Do you have any advice for families that are just starting out on this journey and hearing the word CDH?
Wow, I could probably go on for days, but I won't. I won't take all your time. Oh my gosh. Like I said in the beginning, I don't think you can ever be prepared, like fully actually prepared for what you're going to go through. And just, you know, the parents, that they have to stick together, you know, because this weighs on other things in life, like your relationship and your, you know, marriage, and other, you know, if you have other kids, they suffer because their parents aren't there, and like all these other things outside of the hospital. Life still goes on. And, you know, it's just, you have to try your best to balance everything. And, you know, your baby is going to be so strong, and just pray and have as much faith as possible. Because that's what we've done. We've prayed every single day. And, you know, just for me, I think God does listen. You know, I know other people have other beliefs and stuff, but he does know, and he listens. And just take one day at a time. You know, seriously, one day at a time.
Right.
And whether you're there for 2 months or 3 months, or like us, almost a year, you know, just take it one day at a time.
Right.
So
anybody out there listening that may be a nurse in your area, what would you like to say to them?
Please be Ollie's nurse. Like, in what aspect? Like, what do you mean? Like,
how important, you know, we've got so many CDH families still in the hospital waiting for nursing care. Share your thoughts on that and why it's important that you guys need help, because you want to take your baby home.
Yeah, I think that a lot of, just in my experience recently with trying to find nursing, like, I don't think these agencies and even the nurses maybe realize how much we've gone through, or how long we tell them, but they don't realize the impact of what it's like of seeing or having your baby in the NICU, and you're so close to going home and you can't because there's no nursing. And, you know, Ollie deserves to be home. You know, he's doing so well in the hospital. I think he'll do 1,000 times better at home. And, you know, he deserves to be home, and so do we. And it's just kind of maybe being more understanding of what a family has gone through and what they are going through, and that they just want to go home.
Right. So do they think that Ollie will go home before he turns 1? Is that the goal?
That is the goal, yes. Yeah, and I pretty much, I'm sure they're tired of me saying it, but I say that pretty much every day when I go. I'll just tell the nurses, we have to get him home before he's 1. We are already planning his birthday party. We're like already, you know, starting to think of different ideas and stuff because we are really hoping that he'll be home.
I hope he is home too, before you know it.
So we may have some promising things coming up this week, so fingers crossed.
Fingers crossed over here. We're praying for you guys, and we're praying for Ollie, and we hope he keeps making that good progress and that you guys can take that sweet boy home.
Oh, thank you. And I want to say thank you to you and Dawn.
Oh, you are very
You guys
welcome.
have been, if it wasn't for you guys, I think I've lost my mind a couple times here or there throughout this process, but just having the support and like knowing you're not alone, like really that makes a big difference.
Oh, you are very welcome. I remember your first emails and back and forth with you, and I'm so glad that your journey has ended, you know, this well, and that you're so close to taking a baby home with you.
Oh my gosh, you have no idea. Well, I'm sure you do now.
I love checking in. I love to see your updates. I love seeing Ollie's face and his smiles and his progress. It's amazing to see him reach those goals. It just is.
Yeah, we're so proud of him. He's doing very well. He's a trooper.
He is. He draws his strength from his mama too. So keep being that advocate for him and being that voice for him.
And he gets his positivity and his humor from his dad.
Oh,
he's such a funny baby. Like, he makes me laugh. He's so funny.
Oh, that's precious. That's precious.
Hi, this is Jose Canseco. On April 19th is International Congenital Diaphragmatic Hernia Awareness Day. CDH affects thousands of kids a year, 1 every 10 minutes. Survival is 50%. Cause unknown. We are holding a telethon for charity cdhi.org. Today is CDH Awareness Day. Please donate to help the kids.
Hi, my name is Sophia. Almost 15 years ago, I was born with CDH. I had a 10% chance of living. I am a CDH survivor. Please donate to CDH International.
CDHI has been a part of our family for almost 15 years now. Thanks to CDHI, we understand a lot more about our daughter's birth defect and her treatment options. Please consider donating.
Hello everyone, my name is Kevin Wu, and April is Global Congenital Diaphragmatic Hernia Awareness Month, and CDH International is a charity organization that encourages people to participate in fundraising, raising awareness, sharing their stories, and donating to their telethon. For more information, please check out cdhi.org. Thank you so much for your time.
Hi everyone, we have Walt here with us today. Walt, please introduce yourself. Tell us where you're located at, what state and city, and a little bit about your life before you heard about CDH, and explain to us the first time you heard the words congenital diaphragmatic hernia.
Sure. My name is Walter Surgis. I live in Springfield, Illinois. And I've been married to my wife for about 25 years, and we had our first child, Emily Ruth, back in December of 1998. And at that time, we were really excited about our new daughter coming on the way. And back up just a little while, when we first found out that my wife was expecting, we went to have a regular sonogram done. And they had the sonogram done on Emily. And that was probably back in March or April of 98. They had the sonogram done on Emily at that time. And when they had it done, they wanted to check out to make sure everything was in the proper area, that her organs were right and everything looked good. Well, when we went to get the sonogram the first time, the technician was afraid that the machine wasn't working correctly, and tried to come back another day to get a better view of Emily. So we came back second time, and at that time when they had the sonogram, they kind of had the same picture, the same results that they had the first time the sonogram was done, and they weren't able to view her heart and her stomach in the same view, the same angle. And at that time, they obviously they thought that, and it wasn't the machine this time. It was something wasn't right, and they wanted to get a better sonogram done of Emily, just to find out exactly what the issue is. So they sent us to a sonogram technician that was more familiar with abnormalities. They sent us to that person, and they did a sonogram, and they did find out that the sonogram was working correctly. It was not showing, there was a defect with Emily. And at that time, the technician came in and looked at the sonogram and thought there was an issue. So then they went back out and brought the doctor in. And the doctor came in, and he was pretty blunt. Basically, that's when we first heard about congenital diaphragmatic hernias. And he said that they needed to send us to a high-risk obstetrician for further care. It did say as well that at that time the survival rate, the doctor was pretty blunt as far as what the information was. Survival rate was pretty slim at that time. Like I said, that was probably around in July of 98 when we found out that there were issues. This was our first child that we had. We were really excited, and being new parents, we were kind of, it was a new area for us, so we didn't know what to expect. We just kind of went with what we had. I mean, nobody's prepared for anything like that. So we had a lot of support to help us along the way.
Yeah, you're right. No one can ever be prepared for that at all. Can you tell us what happened when Emily was born?
Emily was born on the 3rd of December in '98. 2 weeks prior to that, they wanted to have Emily delivered or born in a controlled or a ready time period. They didn't want my wife Cindy to go into labor. They wanted to be ready for her to go into labor. So about 2 weeks prior to Emily's birth, we were in St. Louis at the Children's Hospital, and they were checking her amniotic fluids, trying to make sure basically Emily was developed as full as she could be. And that was when they took a test around the first part of December to make sure that everything was ready. So we went, had the test done, and came back, and they called us over to the hospital when they said that they were ready to have Emily delivered. So at that time it was kind of a scheduled delivery. It wasn't the, oh goodness, let's grab the diaper bag, it's time to go. We already knew. That was one thing that we had, I guess, an advantage is we had a lot of time to prepare. We had a lot of things kind of prepared and planned ahead of time. So we went to the St. Louis Children's Hospital, and for 22 hours, they tried to induce my wife. They wanted to try to have a regular delivery. She wasn't able to dilate enough to deliver Emily. So they finally decided that it's time to take her by C-section. So Emily was born on December 3rd, and she weighed a little more than 5.5 pounds. And actually had me inside the delivery as well. So at that time when Emily was first born, she they rushed her away just really quickly. Didn't really have a lot of time to say, oh, we're parents. Emily was, they rushed her away. At that time, even my wife, since she was having a C-section, she wasn't able to really see anything, because she had the epidural. She was having a surgery herself, so she wasn't I guess involved in it as much as she wanted to be, because she was having a C-section. But I don't think any of us were, because they took her right away. And they took her and tried rescuing her as best as they could. Placed her in an isolette and was ready to take her over to the NICU.
Can you tell us about Emily's life?
Emily, she was born on the 3rd of December. When she was first born, they were trying to determine what they needed to do to try to help Emily as much as they could. And it seemed at that time, it seemed like there was a lot of what ifs. They didn't really know what a good plan of action was. So there seemed to be several other doctors in conferences with each other. And when Emily was in the NICU, they finally decided after she'd been born, 4 days later, she would have surgery. And that was basically to repair the hernia that she had. They knew that she had that issue. They knew that that they needed to repair it. However, they didn't know what the end results were going to be. So at 4 days, she had her surgery. She was placed back in the NICU, and we were able to see her anytime we wanted to. And each time that we saw her, we were given stats. It was kind of odd that my wife's a nurse, so she knows a lot more of the details about oxygen level and blood pressure and all of the stats that we were given. So it was kind of odd to hear all the different numbers that the doctors and nurses were giving. We found out as well that Emily had at certain times before and after her surgery, certain times during that, she would have a good stat. Her oxygen level would be at such and such percent, and then 2 hours later it would not be so great. It was definitely not anything that was normal. Things changed. Her stats changed throughout the day. So it was very difficult because we didn't know what to expect. We didn't know if the doctor was going to call and say she's doing lots better, she's going to make it. We didn't know what to expect, and it was very, very helpful that my wife's a nurse, because she understood. She understands the medical technology a lot better. So at 4 days, Emily had her surgery, and after her surgery, we wanted to interact with her. Babies like to hold on to the parent's finger, or they like they move. They you can tell that they're it's a living person. So at that time we were really excited, because we could tell that Emily was there. She would grab her fingers, or she'd wiggle her feet a little while. so we were excited at that time because we knew that and she was getting the help that she needed. But after a week or two, the medical staff tried different procedures, different techniques to try to get Emily's body to survive. And it was at that time when they, after trying all the different procedures they could to try to get Emily to breathe on her own, basically, they had to come to their end result, and their last hope was with their machine that's called the Ecmo Machine. And basically what that was doing was trying to take the blood out of Emily and put more oxygen into her blood. And then that was the problem, that Emily wasn't able to produce her own oxygen from her lungs. And the reason was because when she had the hernia in the diaphragm, her contents, her digestive system, basically was up in her chest cavity, and so her lungs couldn't grow like they were supposed to. And they thought by repairing the hernia when she was 4 days old that her lungs would be able to develop on their own. And that wasn't the case. She weren't able to get her lungs to work like they were supposed to. So the last, I guess the last hope was the Ecmo Machine, and basically that would take oxygen and put it into Emily's blood and put it back into her, and that seemed to help. When they put her on a different apparatus, whether it be giving her more oxygen, trying to increase her blood pressure. At the first start, it seemed like they found the answer as to what they could do to help Emily survive. But it was each time that they tried something new, we had the hope that it was going to work, and then a couple hours or even a day later, they would find that that it didn't work, so they had to try something different. So at 20 days, they tried the Ecmo Machine, and basically the machine itself developed a yeast infection, and so in order to take that infection out, they would have had to put in a new machine, new tubes and everything. And at that time, both me and my wife we were ready to let Emily go because she had been through so much. The experience itself is never something that you prepare for. like I said, we had since July of that year that we were able to prepare for it enough, but no parent's ready to experience anything like that.
No, not at all. And we've known your family a very, very long time. I think Cindy found us pretty soon after diagnosis.
Mm-hmm.
Yeah. So Emily's been a part of our CDHI family or Cherubs family for a very, very long time. And she's not the only one in the family with CDH.
Right, right.
So do you want to tell us how that
Sure.
out your life again?
Sure. Just here recently, I've had a surgery that I didn't find out that I was going to have. I was born in 1971, and at that time, technology and medicine was a lot different than what they have now. So when I was born in 71, they would take X-rays to make sure, every baby that's born, that everything was okay. And when I was first born, they had an X-ray done, and they saw something that just wasn't right in my chest cavity. At first they thought that I had a hole in my heart, and so they did some tests, and they found out everything was okay with my heart. But they came up with the idea, like I said, the technology wasn't super great at that time, but they came up with the understanding that my kidney was up in my abdomen more than where it should be, and they found that it was actually right up against my diaphragm. And they thought it was just there was no reason for it. There were no tests done or anything at that time, and found out that the functionality of my kidneys and everything worked fine. So I just lived an everyday life, didn't have any issues or thought anything was wrong. And so as I gotten older, it seemed that the kidney actually wasn't just up against my diaphragm. It was actually had broken through into my diaphragm. So I had a hole in my diaphragm, or a hernia, but at that time, my kidney had blocked the hernia, so it didn't affect my breathing or anything at that time. And then about 2 years ago, when I was on the beach, I was roughhousing with my son-in-law. Took a dive onto the beach sand, and it just felt like one of my ribs had broken. My ribs were very sore for at least 6 weeks to a couple months. And at that time, something just didn't feel right. So within the following year, found out that by CAT scans and other tests, found out that my kidney actually poked all the way through my diaphragm and up into my chest cavity. The technicians and the doctors at that time were kind of really surprised because all of my abdominal, my spleen, my liver, all of that was up into my chest cavity, and they were actually extremely surprised that I was even able to breathe, because my left lung it didn't have enough room to expand, and I guess just as I lived my life, I never knew any difference. So at that time, I went to see a thoracic surgeon, and he had said that it'd be best to have that repaired, because we're not sure if any other damage would occur, or if at some time my lung wouldn't work like it was supposed to. So at that time, the doctor basically said it'd be best to get that repaired. So on April 30th of this year, I had a surgery done, and they found out that my diaphragm, I didn't have any diaphragm left. There was nothing to be repaired. So in order to repair, they used a piece of mesh to go in and basically be secured to my ribs to block everything from entering my chest cavity. Other than that, I never really had any type of trauma or any other major accident or fall or anything of that nature that would have caused the abnormality that I have.
Wow. And no other cases in your family like this at all?
Nothing. No.
That must have been a shock to hear that diagnosis with you after everything you went through with Emily, knowing exactly what they were talking about when they said that with diaphragmatic hernia. That must have been, must have floored you. It would have me.
Yeah, it was. It sounds interesting because I would have wondered what, with the technology that they have now, what it would have been like back at the time when I was born, what their strategies would have been, or if there was any type of procedures they could try at that time.
In 1971, there was no ECMO. And there's only about 2% of babies survived in 1971, and those were the least severe cases of CDH, which obviously you fell in that spectrum because you've gone almost 50 years with that issue not really rearing itself. So that's a blessing. It's a blessing that it wasn't so severe that it was diagnosed.
Right, exactly.
Yeah. Wow. Well, I'm really sorry that you had to go through that this year, and I'm so sorry about the loss of Emily. The whole charity felt her loss at the time because we were such a small group back then, and and so we definitely have not forgotten her, and I'm sorry that we have you as a member now too as a patient. That's not something we ever want for any of our families, to have two people signed up as patients. But thank you so much for sharing your story. And you really have both extremes in your family, the best case scenario and the worst case scenario. And
it's true.
Hey there, this is Jack Wagner. How is everyone? I'm just giving a shout out to the CDH International charity. This is about awareness, hernia awareness. So I want everybody to take care of themselves and take precaution and do what you need to do to make sure that we don't run into trouble. Okay, have a beautiful day.
hi, everyone. Wasn't that an incredible story? All these stories have been amazing. And to update you on the previous story, Ollie is home. He came home right before his first birthday. So we're really excited for his family. He's doing wonderful. They found nursing and he's doing great. And the Surges family, we're so grateful for them sharing their story. It's so unique. We have quite a few unique CDH cases that we have showcased today. And if you'd like to share your story, if you're a CDH parent, and you're watching this, you want to share your story, go to cdhi.org/share-your-story. If you don't know, we are on the air every week doing a radio show. So cdhradio.org. Come listen to the show. Be a part of it. And if you're just hearing about CDH for the first time and you're touched, please donate. Please help these kids. We have some updates. First, we want to do a shout out to Jason. Jason runs a research registry for us. But today, Jason is helping us with the telethon on the back end. And we were really excited when he texted us that it was, what did we say it was?
We thought the comma was in the wrong direction.
$118,000. All of a sudden, I'm like, what? And then he corrected himself. So we're over 18,000. It was almost 19,000, correct?
Almost just shy. Very, very close. Probably over 19 already.
Yeah, probably about over 19 now. So we're doing really great. Keep that money coming in to help these families. There's lots of things we really want to do. And if you want to be a philanthropist and donate, we are more than happy to create grants in your name, scholarships in the name of someone you love, so that we can help these families any way that we can. We would love to do that. And your loved one doesn't have to be a CDH patient. If you just want to really help these kids and make a big difference, we would absolutely do that. We will, whatever it takes to get these families some help. So on the ribbons update, we have, as of 6:25, Olivia Case at 101 and Elijah Bold at 100. So one ribbon. Elisha's family, come on. I mean, we love Olivia, but come on, one ribbon. And Braden Shiloh is at 80, and then Connor Bray's at 79. So neck and neck right there. And then following up in fifth place is Juniper with 64, and Juniper's mom, Jennifer. All these light ups that you see, we have 100 and over 150 light ups around the world going on, and you're going to see some in just a minute, the places that are lighting up. Jennifer has been phenomenal. She has written probably 125 of those places to get these these places lit up. That's the correct English. And we're very grateful to her. So thank you, Jennifer. I just want to do a shout out, and we thank you. And I know Jennifer is so proud. So very proud of all you've done, because it takes months to do this. It takes a month to put April 19th together, and it's all done by families who have been affected with CDH, like Dave and I, and then people volunteering. And so, but we know what CDH is. We don't need awareness. We all know, and our families and friends know. So it's so important, if you're watching this live video or you're on social media, that you share our post so that we can reach people who don't know about CDH. So those are the people we really want to reach today. And then we are going to have some updates on the Facebook fundraisers at the next update. And let's watch some light update. What do you think?
Yeah, absolutely. We have a couple.
Let's do that.
Hello, hello, hello. All right, hi everybody. Eric Nelson here. We are waiting for Don and David, who I'm sure will be coming back any second. Let me scoot back. My face looks very close on here. Do-do-do-do. So happy to be here. Gosh, listening to all the stories and families, and oh man, it really has broken my heart at times, but also extremely motivated me at times as well, and really just kind of educated me on the idea that there's still so much work to do to help and to spread awareness and to make a real difference for CDH survivors and families that are going through it currently. And I want you all to know, for those of you who don't know me, my name is Eric Nelson. I'm an actor. I'm on a TV series called 1883. It's on Paramount Plus, and God's given me this platform right now through the arts that I'm excited to utilize to my benefit to help support and bring awareness and invest myself in CDH and just truly try to give as much helping hands as I possibly can, while y'all are, sharing your stories and kind of, really opening up your heart and personal lives to us. It's touching my heart so much, and I will be utilizing my platform that the show has given me to help and to help in any way that I can. So I want everybody watching and listening to know that. And I want to thank y'all. I want to thank you for your bravery. I want to thank you for your strength.
Do we have too many videos?
And hey guys.
Hi. I broke it, Eric. I'm sorry.
Oh, you're okay. I was just, when you tell me there's an open mic and I could just start talking, getting me to stop might be the hard part. So
no, that's fine by us. No worries.
Yeah, I hit a button. We need to fire me. We really need to fire me.
I don't
and
know
hire
about that.
someone else.
This is a lot to juggle. So I don't know how you do it. And I'm impressed by everything that's been going on today. So
thank you. And thank you for covering for us and doing a great job. Appreciate that.
You're very welcome.
It seemed natural that you just took over and just started talking. So
yeah.
See, it took me a couple minutes to know if I was live or if people were seeing me. And so once I realized, I was like, oh, okay, open floor. Time to get at it.
Absolutely.
Do you want a job? Because you can take mine.
I don't know if I could do what you do. That's for sure. I don't, this is a big operation and a lot of moving parts. And I'm going to have to let you hold those reins, but I'll be on the horse right behind you.
Yeah.
Oh, awesome. Thank you so very much. Thank you. So we just showed a lot of light ups, and we have someone who's going to join us from San Diego, one of the moms, when that light up happens right before the end of the night. And then we might have another one jump in as well to show us one of the light ups going on. But all over Twitter right now, we have landmarks in Europe who are already sharing the pictures of their buildings lit up. And the hardest part about doing this telethon is that I can't be everywhere to see all the light ups happen, because I'd really love to be in Dublin and see that castle light up tonight. I would, but
as would I. You got to share photos of that, because that just is going to be incredible.
Yeah, we definitely will. So we just talked to a lot of families, one sweet family that lost their little boy, and then another family who dad had CDH and the baby had CDH, and then a family who was in the hospital for almost a year. And after we filmed their interview, they went home right before his first birthday. So that's incredible, and we're so happy for them. And it's been a good day with good stories.
Amazing. And they're now out of the hospital, indefinitely.
We hope so.
Yeah.
Yes, we hope so.
Good, good.
Yeah.
Oh my goodness, what a blessing.
Yeah.
Wow.
Yeah.
Now, and
Well,
I also heard we've raised a good amount of money so far today. I heard some numbers thrown out there. I'm encouraging everybody, and hopefully we can raise those numbers significantly by the end of tonight. And this is great. This is phenomenal.
Yeah, they're doing great. We always need more funds, so we're encouraging people to keep donating. And then we have a very tight contest between the families who are fundraising because they want to hear you shout out their children's names at 10 o'clock. So the top three, we are going to text you their names so you can do that. And so they're really excited about that. Any way we can raise money, and it's for a good cause. So
absolutely. And if there's some way to, I'm not sure how on the donations page, are you able to see amounts, specific amounts that are donated and who donates them, or is it all kind of vague as far as on the donation side? Because I had an idea. I was like, what maybe we could utilize some sort of autograph something, or a personal phone call, or some sort of something I can give. Maybe that might make somebody excited to maybe donate a little something extra. I didn't know if there's a way for us to track individual donations or not.
We can track them on the back end. So if we sent you a cowboy hat and you autographed it and sent it out to someone, to the first person that donates $1,000 before the end of this telethon, does that sound good?
Absolutely. I would love that.
Let's do that.
I would absolutely love that. And however many, if we get multiple thousands, however many hats we can sign, the better. So that sounds great.
Awesome. Wonderful. Thank you. Thank you so much, Eric. Well, we've got some more families to hear from, so we're going to jump to them and hear the next story, and we'll see you in a little bit.
Okay, let's get those cowboy hats.
Let's do it.
Sounds good. See you soon.
Thanks, guys.
With Opal.
So literally, I've known nothing. I've never even heard of this before. Congenital Diaphragmatic Hernia Awareness Day, but I didn't even know this was something that happened. It's amazing. So the mom has the baby certain places in the hospital, but what it is, and then as soon as the baby's born, there's people right there that take care of the baby. And so having to know about it ahead of time is really, really important, so they can get the baby the care that they need. And it just there's a hole, and so all their organs can go all over the place. And oh my gosh. So new life is hard. New life is so hard. Babies, there's so much change. And once, anytime a baby is born, it's such a rough awakening. But to be born and to have complications from the very beginning is exhausting. It's exhausting. When Maddie had Evie, we went to the hospital, and she had so much stuff in the first several days of Evie's life. She was in the hospital and Maddie was there, but Maddie had to be separated from Evie and had to get up and walk down to the NICU every couple of hours or so to feed her and then walk back up again. And I was with her for a couple of days, and it was like Janelle and I just traded off a bit. It was exhausting. And I love the idea of spreading awareness so moms can get checked and then they know what's going to happen. So we knew what was going to happen. We knew what to expect. And even then it's exhausting. So I love that there's some more awareness out there. I've took a screenshot of this so I can definitely spread the word even more so. And just thank you so much for everything that you do for this organization. Thank you for spreading the word. Thank you for spreading awareness. I think it's a wonderful thing to do. And thank you for telling me about it so I can help as well.
Happy CDH Awareness Day, everybody. Please donate to help the kids. Go to cdhi.org for more information.
Hi, Chris Kirkpatrick from NSYNC here. I just want to say April 19th is Congenital Diaphragmatic Hernia Awareness Day. Over 52,000 children are born with CDH every year. Only 50% survive, and the cause is unknown. Please help CDH International to fight this horrific birth defect. Donate at cdhi.org.
Hey everybody, this is Billy Gilman. On April 19th, it's the International Congenital Diaphragmatic Hernia Awareness Day. You know, CDH affects 1,600 kids a year in the US alone with a 50% chance of survival. It is my mission to always be at the call of anything related to young adults and children. And of course adults as well, but when a child looks at you as if you're some kind of a hero for just doing the greater good, as we all should, as much as we can throughout our years on this earth. You know, children are our future, and if we can come together and create a better future for the ones that are less fortunate than the majority, then that's a huge battle won. It's better than any platinum record or better than any Grammy award. So I ask you to please go to cdhi.org and help these children. They need you. And let's get together and create one big voice for these kids. Thanks.
Today, we are here with Sherry and CDH survivor Opal. Would you guys like to introduce yourself and tell us where you're from?
We are from Northeast Georgia. And I'm Sherry, and this is Opal. Opal, would you like to say hi?
Hi, Opal. How old are you? Did she say 5?
She said 4.
4. You're 4 years old. You're becoming a big girl. So tell me, Sherry, when were you guys diagnosed with CDH? Was it during your pregnancy or at birth?
It was during pregnancy. We were diagnosed at 18 weeks. We were kind of surprised. Opal's an identical twin, so we were going to a specialist just to make sure that they were growing properly, and we weren't really expecting the diagnosis.
How did it feel to get that diagnosis that day? What went through your mind?
I mean, the first thing really went through our minds is we didn't know what it was. It was something that we had never heard of before. We were scared, and we felt very alone because we didn't really feel like we had anybody that we could talk to that really understood what we were going through at that time.
Mm-hmm. So after you were diagnosed with CDH, how did the pregnancy change from there concerning follow-ups?
So we were already seeing someone every 3 to 4 weeks just because we were high risk with the twin pregnancy. But it went from seeing someone every month to seeing someone every week or twice a week. And we were meeting with cardiologists and surgeons and people that were 2 hours from where we lived because no one close to us could handle her care.
So did you stay in Georgia for care, or did you guys relocate?
We did stay in Georgia for care. We ended up going to Atlanta. We delivered at Northside, and then she was moved to Eggleston at 3 days old.
Okay. How was the other twin? Was the other twin healthy?
For the most part, they were born at 31 weeks, so they were pretty premature. And the other twin, she was healthy in the NICU, and she came home, but then she developed necrotizing enterocolitis, which is death of bowel and stuff, and it's linked to prematurity.
Mm-hmm. So both your babies had to be in the NICU, and were they in the same NICU, or they were in separate NICUs?
They were in separate NICUs, so they were at 2 different hospitals, and with traffic in Atlanta most of the time, even though the hospitals were only a few miles apart, it would take about an hour between both hospitals with traffic.
Oh. So you guys did you have other kids at home at the time, or just the girls?
We had 2 older kids at home at the time as well.
You had to work around their schedules and routines and try to be with your babies.
Yes. If it wasn't for our family support, I don't think we could have made it through that time.
So tell me a little bit about the day that Opal and her twin arrived.
We went to Atlanta actually to meet with the doctor that was going to deliver them. I had not met him before that day, and I happened to go into labor while I was down there. So they tried to stop the labor once I got there, but my water broke around Opal, so she was transverse breech. They went ahead and did a C-section at 5:24 in the morning.
Oh.
And she was very sick. She was one of the sickest babies they had ever had in that NICU.
Right. How big was she when she was born?
She was only a little over 4 pounds. So I think she weighed 4 pounds 11 ounces, but by the time that she had had surgery, she was only 3 pounds.
Wow. Wow. So tell me a little bit about after the babies arrived. Did it take long for them to get her stabilized? What your journey was like? Were you able to recover from the C-section and be with her?
So during the first hour of recovery after the C-section, they worked on both of them, but Opal, she had a lot of trouble. She couldn't breathe with the ventilator. She needed an oscillator. She was maxed out on nitric, and she could not be touched. So for diaper changes or anything, her stats would drop, and she would get very, very sick, and she had to be bagged multiple times. I actually didn't get to see her for the first 12 hours after she was born. So most of that is related to me from my husband and her doctors.
Mm-hmm. And when her twin arrived, they took her to the NICU as well?
They did. She needed a CPAP machine just because they were born early. I got lucky and went into preterm labor once before, so they had a steroid shot for their lungs.
Okay.
So I think that helps. No, not for you. I think the steroids helped their lungs develop what little bit they had.
Mm-hmm. Mhm. So how long was it before they were able to do her CDH repair?
She had her CDH repair at 7 days old in the NICU bedside at Eggleston. She was transferred to Eggleston at 3 days old, and she was just really sick. She wasn't really stable at all. She came off the oscillator for a couple hours, long enough to be transferred, but needed it back. So with the oscillator, they couldn't do the surgery in an OR. So they had to make an OR out of her room in the NICU.
Right. How did surgery go? Did they have to do a CDH patch, or did they just do sutures?
So they had to do a patch. She was missing all of her diaphragm on the left side and had very little on the right side.
Should they consider her more of a bilateral CDH case?
So it's still listed as a left-sided CDH, but they did consider it kind of bilateral because it was I don't know, it took up both sides of her chest cavity. She had all of her abdominal organs in there. She had kidney, spleen, liver, all of it was up. So she was really severe.
Right.
But we didn't know that she was that severe until she was born.
Wow. So was ECMO used at all during her care?
It was discussed multiple times, but she was too small for ECMO. And then after her surgery, she developed multiple blood clots, and they felt like it was unsafe for her at that point.
After her surgery, did she have many complications in the NICU? Did she have things arise that kept you guys backwards on your journey instead of forward?
Yes, she had the blood clots. Like I had said, there was multiple feeding issues. She ended up needing a G-tube placed at 3 months, and when it was placed, she developed a surgical infection that ate a hole from her stomach to the outside of her belly, so she couldn't use the G-tube. So that kept us there longer. She was oxygen dependent the entire time, even after she came home. And she had multiple food allergies and just a lot of feeding issues.
Do you remember the first time you got to hold her in the NICU?
I do. She was 3 weeks old.
Oh.
And she had finally came off the oscillator after 3 weeks, and she was still on a ventilator, and it took 3 nurses to actually help us to get her onto my chest for me to hold her. I taped her ventilator tube to my shoulder so that way it wouldn't come out or anything.
Oh,
it's one of my favorite pictures, actually.
Oh, I bet. So what was the journey like with having your other daughter in the NICU? Did you split your time between the babies?
I tried to make sure that if we went to see one, that we saw the other one as well. I tried to make sure that we spent an equal amount of time with them. And then once her twin got to come home, I got it approved with the other hospital to bring her twin with us.
Oh, that was
so
special.
They got to be together for a couple weeks before her twin got put back into the hospital. But when she got put back into the hospital, I requested that she be put in the same hospital. So they were both at Eggleston, but on different floors. So I just went back and forth between the floors to spend time with them both, and I stayed with them while they were there.
Okay. Well, tell me what life has been like after you went home with Opal.
It's been kind of surreal, I think. I know she came home for about a week. When she left the NICU, she was there for 6 months, and she caught a cold. It was something simple, but it put her back into the hospital, into the PICU, back on a ventilator for a couple weeks. And that first year, we would be home for maybe a week or two at the most, and then we'd be back in the hospital for a week or two at a time. And as she got older, that got a little bit better. She's had 2 more CDH repairs since then.
2?
She still gets, yes. So she's had 3 total. And
wow.
She has had issues with her esophagus needing it to be dilated. She's actually supposed to have a dilation in a couple of weeks again, just to make sure that she can still eat properly the way she needs to. And this is the first year, knock on wood, that we haven't spent any time in the hospital yet. So
that's good.
We hope to not have to anymore.
Is she eating orally too and still through her G-tube?
Yes, so she does still use the G-tube at night. She does continuous feeds overnight to help with weight gain, and then she eats by mouth during the day.
Well, that's good. Do you have any early intervention that helps with anything or concerns, or?
So she has seen speech and feeding therapists since she left the NICU. And we've worked really closely with them multiple times a week. Yes, she loves therapy. It's one of her favorite parts of the week is getting to go to therapy. So she really enjoys it. She had 2 feeding tubes. She had a G tube and a J tube, 2 separately. And we were able to remove the J tube last year, and she's been able to come off the oxygen this year.
My tube is clean.
I know.
Yeah. Are you sharing your feeding tube?
She was trying.
You are a warrior, Opal. You are so strong. On her second and third CDH repairs, did they go in and have to use a different type of material, or are they still using Gore-Tex to repair that?
So her patch is made out of 2 different types of material. Part of it is Gore-Tex, and I cannot remember the other material they used for the other part of it. But the other part is supposed to be more like durable, but it doesn't grow. And the Gore-Tex kind of grows with her. But when she hits growth spurts every so often, she needs a new patch and needs scar tissue removed. And her time spent in the hospital after the surgeries has decreased with each one. So
that's good. That's very good. So how has life been with having both girls home and having 2 at the same age?
I enjoy it. They are really sweet when they're not together. They like to fight with each other, and I think that's all kids, I think, but twins especially, I think they're so much alike that they just kind of butt heads a little bit.
Yeah, they can. What's your sister's name?
You want to tell her name? I say Naomi.
Naomi, that's a pretty name too.
Thank you.
So if you were approached by a CDH family just starting out on this journey, what advice would you give them as a CDH parent?
I would just say to really like lean on your support system that you have, because it is a very long and difficult journey sometimes, and sometimes you really do need somebody that you can vent to kind of let it off of yourself a little bit, to give yourself a break from the worry and the stress and all of it.
Right. That is very good advice. Very good advice. Is there anything else you'd like to share about Opal and her journey with CDH?
Anything you want to share?
At 4, does she recognize her scars? Does she see those and ask questions?
I think she's just kind of used to them at this time. She doesn't really point them out anymore unless they hurt or bother her. She recognizes like feelings and stuff in her stomach now, and pain and stuff like that, and she'll point it out, but she doesn't really mess with the scars anymore like she did.
So her lung volume, does she have a full set of lungs, have they said, or is they compromised?
So her left lung is still chronically collapsed on the lower lobe. But her right lung is fully expanded and it's doing well.
That's good. That's very good. Did she have pulmonary hypertension? Did she have any complications from pulmonary hypertension?
She did. She was on multiple medications for pulmonary hypertension through her first year of life, and we were able to wean her off of the sildenafil and the heparin and Lovenox and stuff like that. And then she's still monitored every year for it, just to kind of make sure that it doesn't come back.
Right.
But so far, she's done really well since coming home.
That's good. So do you guys just have yearly checkups now, or do you go more than often than a year?
We go every 3 months still to see multiple people. She still sees everybody but cardiology. So we try to get her specialist all in one appointment. She'll see surgery, pulmonology, GI, and dietary at one visit, and then she'll see nephrology and endocrinology at another one usually.
So literally, I've known nothing. I've never even heard of this before. Congenital Diaphragmatic Hernia Awareness Day, but I didn't even know that this was something that happened. It's amazing. So the mom has the baby certain places in the hospital, but what it is, and then as soon as the baby's born, there's people right there that take care of the baby. And so having to know about it ahead of time is really, really important, so they can.
Hey guys, it's Tommy Lee, and I want to wish everybody a happy CDH Awareness Day. Please donate and help the kids. This is a terrible disease that affects 1,600 kids a year, killing like 50% of them. So they're holding a telethon at www.cdhi.org. Okay? Go there. Donate some damn money. Bye.
Hey everyone, this is Vince Neal. It's CDH Awareness Day. Please donate to help all the kids. Give generously. Thank you.
I'm Jean, Ryan's mom, and the first time that we heard that phrase was after our son was diagnosed in utero, and my husband reached out to a specialist, Kristen Gosnell, in California, and she actually informed us of what the name was of this birth defect.
What was like? Go ahead.
Hi, I'm Brian Williams. Pretty much the same thing. My mother-in-law happened to, I was working, my mother-in-law happened to go to the 16-week checkup with Jean. And I remember Jean calling and telling me that that the doctor wanted to speak to us. So I wasn't there. It was over the phone, and I just had kind of a bad feeling. 16 weeks, everything should have went A-okay, and the doctor wants to talk to us. So she pretty much even explained really what was going on, just that his diaphragm didn't form, and that she highly recommended termination. So at that time, my wife's with my mother-in-law, and we meet. I leave work, we come back at home, and on the way that she was coming back from her OBGYN appointment, I happened to get in touch with the nurse, Kristen, and was able to get Jean finally on three-way call. And Kristen was great at kind of letting us know everything that was going on, and don't jump to anything too quick. And she calmed us down and got all our records, and steered us in the right direction.
Did you guys stay there locally then in a hospital, or did you guys relocate for care?
So what we were going to do is there was talks of doing a balloon occlusion first. They didn't think it was that necessary at the time. So we wound up, we're in Queens, and we're lucky here in New York that there's tons of hospitals around, and so we were steered to go towards the Children's Hospital in New York, which is about an hour and a half ride from us in Washington Heights from where we are.
Okay. How was your pregnancy from diagnosis? How was your rest of the pregnancy?
Well, I believe I found out sooner than many pregnant women do here, because I actually have a birth defect myself called uterine didelphys.
Okay.
So I found that out as a teenager, that I have 2 of every female organ, including 2 uterine horns.
Okay.
So because of that, we found out sooner than I think most find out, if for those that do find out when they're pregnant, because all of my sonograms were high risk. So through our research, I've heard that many pregnant women, back then 5 years ago, find out at their 20-week full anatomy scan. I found out at my 16-week scan. So that was a bit of a blessing and a bit of a extremely worrisome time that we were living in.
Sure it was.
And then after 16 weeks, and I refer to our journey as just tons and tons of angels on earth that we met. The first one being Kristen Gosnell, and after she gave us so much faith, and to be, I remember the term cautiously optimistic. Be cautiously optimistic. That was like the driving term throughout. And then once we got in the right hands at Children's Hospital of New York, Columbia, in Washington Heights, then I was under another high risk care, Dr. Simpson at Choney, and then we just got lined up with everything. It was a bit of a whirlwind with the tour of the Nicu, and meeting with who would be our son surgeon, Dr. Duran, the ultimate superhero. That he saved our son's life, and everyone through there. So it was I don't want to say that it could have been traumatic, but I decided to rely on my faith and my prayers and my angels above, and my husband too, kept us strong going, and we got through it, and now we have a very healthy, happy, rambunctious 5-year-old.
That's wonderful. Tell me a little bit about the day that he arrived. Were you guys set for an induction, C-section? Did he come naturally?
Oh, it's actually pretty funny. So I'm a New York City fireman, and one of the firehouses where we lost a couple guys back in 1978 is the firehouse that I work in. So Ryan's due date was August 4th, and this mass is on August 2nd. Every year for the past 40 or so years, we've always been with the family going to church, and afterwards we usually go out and just have a couple of drinks, grab some lunch. I just had a bad feeling. We went out to Coney Island. I went out with the guys, and I just kind of wanted to go, and I really wasn't having too much to drink, and it was always in the back of my head. I wound up getting a ride back with them close to Brooklyn, wound up getting my car, and just had a bad feeling. I came home, and about an hour after I came home, Gene said the water broke, and we had to make the trek out to Columbia.
And you said that was an 1.5-hour drive for you
About
guys?
an 1.5-hour drive, yeah.
And thank God there wasn't. Was there Yankee games? They would think because it's right by Yankee.
It's right by
Stadium.
Yankee Stadium, so that would have been almost one of the times where they were letting out by the time we got there. So, but luckily we were able to get there a little quicker than normal.
Right. Well, tell me what happened when you guys arrived.
So we arrived. I think usual. We first went to the maternity. What's the room? I forgot the name of the room. We went to go check if I truly was in labor, and I was truly in labor. So I was like, oh wow, it was we were first time parents, so that was.
I think the best way to explain it is if we went into that hospital as if we were treated as if we were high rollers in like Las Vegas. You walked right in, they knew what was going on, they were aware. Right into a room. Obviously it was our first child, and really didn't know what to expect, but they really laid out the red carpet for. I mainly think it's they had like an asterisk next to it that Ryan was going to be, he was a CDH child, and that it was their utmost importance, to get him taken care of.
And it's interesting in the midst of our pregnancy, in the midst of my pregnancy as well. Of course, we were doing our research, and Kristen Gosnell directed us, and we were reaching out and looking into CHOP in Philly, and like Brian mentioned, the balloon, potential balloon inclusion that could have potentially, which I didn't end up needing. But we were ready to go to California. We were ready to move to CHOP. We were ready to do whatever we needed to get our baby here safely. And I remember that one of my very good friends whose daughter has cystic fibrosis, and she's been through the, rigmarole when her daughter was a baby and she was pregnant and all. And she said, we're just very fortunate to be in New York. Like we had an hour and a half, like one of your questions was, do we need to relocate? A lot of families do. We are just so grateful that we are only an hour and a half from where we needed to be at that moment, and not needing to travel anywhere. Like people come to New York to get the best care, and here we are that we have it. So we're fortunate in that aspect.
We noticed that a lot too, when we joined the CDH International group on, the support group on Facebook. We noticed that, a lot of people are having either reherniations or they relocated already and didn't know who to speak to. And, it kind of made us, we try to get on and offer our advice and, everything that we've been through, because we relied on, the CDH International to steer us in the direction of other families that have been through it. And, we were just so fortunate to, look, I was kind of complaining we had an hour and a half ride home, to the hospital, when there was other people at that hospital, the same one that drove 4 hours,
right?
Just to go there. So.
Yeah, we had two families that, two moms of CDH Miracle Boys themselves, Karen Senior and Maria Breslin, who were just, I don't know if you're familiar with their names.
I am.
But they were our godsends. Like I probably would have had, I could get teary-eyed saying it, I probably would have had severe
postpartum depression.
Thank you. Yes, thank you. It's 10 p.m. our time here. Don't mind me. I would have had severe, and I truly did not. And I really attribute it to the great mom friends that I made, who walked me through every step that was going to happen. So every time that something happened, I knew what was going to happen. I knew what was going to happen next. Like I was more than prepared. Didn't make it any, I don't know what it's like to have a baby that you go home with right away. Even our second also spent some time in the NICU. But I mean, in terms of given the hand we were dealt, it was great to be forewarned of everything that was happening.
That's good. Both those ladies are amazing ladies to have as friends.
Yes.
So tell me a little bit about what happened right after he arrived. Was he stable? Did they intubate? Did you hear him cry?
So she had an epidural a little late. So I don't. Right after he came, we didn't know the sex of him. We didn't know if it was a boy or girl. Gene, I'm okay with it. If it was, I kind of want to get the room ready. Is it going to be a boy? Is it going to be a girl? What are we going to do? Close. Gene wanted, it was like your last true surprise. You could really know it was a surprise.
That's special.
yeah, with everything with everything going on and, everything in the back of our heads, Gene was like, what is it? So I was like, oh, it's a boy. And they kind of rushed me pretty quick to cut the umbilical cord. There was a lot of things that they needed to be done. So he was kind of taken right out, and he was brought into the transitional intensive care unit. He was intubated. I guess they started doing the IVs and whatnot, what they needed to do. I think it was maybe, we didn't see him for 9 hours after birth. And then we were allowed to go into the NICU. But again, that hospital in particular that we went to, we were prepared to see our child in that NICU along with everyone else's child. And at the time, they also had, because they went over Ecmo with us and everything like that. And during one of the visits through the NICU, one of the children was on Ecmo. So we were able to be forewarned of, the possibilities of what would happen.
Right.
So, then after that, we pretty much stayed at the hospital, pretty much until he came home.
Right. So tell me, how long was it before he had his CDH repaired?
5 days.
5 days.
5 days.
And right before that, we have friends and family like anybody else, and want to try to make it as normal as possible. The best experience given the hand that we were dealt. And the NICU nurses were great, and we had friends and family come in, and they said hello, and then it was like 2 or 3 days after Ryan was born, he wound up spiking a fever. So, then we wound up. Only thing in our head was that it was just going to prolong the surgery now. So we kind of stopped all family visits and, just kept it to Gene and I. And it wound up being 5 days after birth was when his repair was.
Okay. Did he need ECMO at all?
No.
No. So
Gene's a runner. So there happened to be a restaurant bar right down the block. It's just recently closed, but it was called Coogan's. And it was a runners themed bar. So we decided that, we just can't sit in the hospital. We know the surgery is going to be long. They'll call us if anything happens. And we wound up getting there. We just ordered food or something to drink. And right away, there was a phone call from the surgeon's office saying that he had to do an open repair, that he wouldn't be able to go in thoracoscopic. So, that kind of started off the first 20 minutes of us sitting down, where, we were in hopes that it was going to be thoracoscopic, but it was wound up being worse than the surgeon originally thought. So they had to do the open surgery.
During the open surgery, did they have to use a patch, or were they able to just suture him back up?
I believe they use a patch.
Yeah, use the patch. Mm-hmm.
Okay. How long was his surgery?
I don't remember.
Too long.
Too long, I imagine.
I mean, not that I'm complaining. I'm grateful they do what they had to do, but as a parent, it was, it was a long.
I'd probably say it was definitely over 10 hours, because I remember it was probably like in the morning or late morning, 10, 11 o'clock, and I definitely remember it was night out by the time we see the surgeon afterwards.
So how was his journey after his repair from there to the end of his NICU journey? How was that?
He was there for, I believe, 37 days. I remember he came home on, I think, September 10th, and he was born on August 3rd. So he was there a little over a month. And his journey was, I think, was for the most part, I don't want to say par for the course, because some people have much worse journeys, and I don't want to, and some people, I think, go through much faster. I do remember that he had suck, swallow, breathe was like a big, big cheer chant that I kept doing with him. I feel like it was pretty much everything.
It seemed like in the hospital, it was just like a never-ending hurdle, in the beginning, and we read the Facebook posts and we comment where we can to be supportive, and it kind of seems like our spat with CDH, where our child now has no restrictions. But we remember when we first there, and it was okay, he's got to have 2 ounces of food. Okay, and he wouldn't do it. So now we're like, this is an entire setback. we're not getting out of here. And then, the 2 ounces lasted for a couple of days, and then that went to, 10 ounces. And then, whatever it was like that last hurdle on that 4th week that we really just wanted to.
76 mLs. I still remember the number. 76 mLs was what he needed to drink to be able to leave. And then that was like a big thing too, like keeping baby wipes on like the back of his neck, on the back, just to keep him awake to get through the feeding. Like, just like, come on,
The poor kid was so tired, from having food shoved down him that he didn't, he would just fall asleep. And
I
we knew
remember those days.
If we got to 76 milliliters, we know that we would be able to go home. And, it is what it is. We're real lucky with, all the outcomes, with no type of, setbacks or any type of, he has no restrictions. And, so, we truly are lucky.
Did he stay on the vent very long, or did he come off quickly after surgery?
So he was, obviously he was immediately intubated right after he was born. I believe for a total of 2 weeks, he was intubated, and then he was on CPAP maybe for about a week and a half. And then after CPAP, we wound up, because we started coming like closer to home. We were staying at hotels in the city, and then we found that Fort Lee, New Jersey was 5 minutes away from the hospital, where we were going all over Manhattan to get in the hospital thinking that we would be closer. But, I think we wound up getting home, and I think we got a phone call from the hospital saying that, hey, we weaned him on and off CPAP all day. Yeah, he's good. He's not on it anymore.
Oh.
So, that was like a shining light that, there's and, the end of the tunnel is near.
Right. And he wasn't on oxygen very long then?
No.
That's great. That's wonderful. He's a fighter.
Yeah.
So what was the homecoming day like for you guys?
It was very, very special. I remember when we were driving home past one community before we got to where we live in Rockaway. And it generally is like, congested, is like one road in, one road out. And I said to Brian, I'm like, I can't believe it. I can't believe it. And he's like, yeah, I know the traffic is so bad. I'm like, no, I'm not talking about the traffic. I can't believe he's with us. Like, it just was so surreal that, we finally were able to bring our baby home, and just so special. And I just feel like as a NICU parent, you just appreciate, not that moms who bring their baby home on day 2 don't appreciate. Of course, we all appreciate our blessings, but I feel like you just appreciate everything so much more, So the homecoming was super special. My mom and Brian's mom, my mother-in-law, decorated and had everything ready for us. And, and they were, of course, so excited to get their hands on their grandson, a little miracle man. And, so they came, my brother and sister-in-law came with the cousin, my niece and nephews. They were excited to be big cousins. And it was a really, really, really special day.
That's neat. That's very special for you guys. What has life been like since you've been home from the NICU? What have the last 5 years been like?
Normal.
I don't know. I babe so much. It seems like we have a 2.25-year-old. He's going to be 3 in 2 or 3 weeks. He was also in the NICU. He was 4 weeks premature. His brothers got him beat. He was there 40 days. His little brother was only there 10. But I don't know. I think like I baby him too much. I think when he falls, it's always oh, is everything okay? Does your stomach hurt? That's always in the back of my mind when the 2-year-old falls. Now he just, if there's a scraped knee with blood, he just wipes it off and he gets on his bike and he keeps going. So
right,
it's always in the back. Because he wound up losing a lung lobe because of the surgery, because of the hernia on his left side. So, which we really didn't even know until the surgeon contacted us with everything going on with COVID. And, I didn't look, you get a stack of papers at 300 pages they're supposed to give to the pediatrician. And, you're like, okay, here, and, so that it's in the back of my mind. I don't know if it's as much as in Gene's, but I know I always kind of, everything he does, just make sure that I baby him maybe a little too much.
I can see that. I can see that with the boys. I have 4 boys, and I think I treat my CDH son a little bit differently than the other 3. They're special warriors for sure.
Yeah.
So has he had any complications, you know, with having the smaller lung?
Well,
with
in the beginning, we thought, what was he having trouble eating? Where we thought that there was acid reflux involved, and we, you know, I don't know how it is in other hospitals that do the CDH surgeries, but in the Children's Hospital in New York, what they do is when we go for our yearly checkup, it's usually in April. It was delayed because of COVID last year. We went September, but usually in April. And I kind of like the way they do it. They have a expecting parent of a child with CDH, and then there's usually another one that's like 2 or 3 years old. Then, you know, 2, 3, or 4. Then there's another one that's 7, 8, 9. Then there's, you know, ones that are older, because they said that Ryan's going to have to go once a year till he's 18. So there's usually someone at like 17 and 18, and we're kind of sitting in the room together. And I think they're doing that to give confidence to the expecting parent to say, hey, look at this. These are kids of all different ages that are here to do their yearly checkup with, you know, the surgeon or the cardiologist, the GI doctor. And one of the parents that were there was, they wanted to do the 24-hour probe to monitor his acid levels. And we opted not to. And we just think it was just something that a kid was going through eating, you know, and, they put us on medicine just as a precaution, but we don't even really think that there was really too much of an issue then.
And they did say he's doing so well. Like when I say, like, you know, I don't really worry with complications now. I just, my faith takes over. I feel like we've been through it. He's doing great. That was then. This is now. He's a functioning, healthy, happy 5-year-old, and that's just how I see him. I just, you know, and they actually said at the last CDH clinic that he's doing so well, we could skip.
Yeah, we skip next year. So
yeah,
that's wonderful.
Yeah, so he's doing really well.
That's wonderful. Is he playing any sports yet? He's getting at that age where he can play the t-ball or the.
Yeah, well, there's a big hockey family here, so.
Are you?
2 years ago, I got him skating on the ice. So this is his second year.
Oh, that's fun.
Yeah.
Wonderful.
Yes.
That's wonderful. Is there anything else you guys would like to add about your journey with Ryan?
No, I think that was pretty much all about it.
Do you guys
my main thing is never take a doctor's first word of aborting. There's always, in my opinion, and through our experience, there's always a way. Like my husband recently said with something else, there's no such thing as impossible. You know,
right.
The word itself says I am possible. I added that. He didn't say that. But I just would say, like, to any expectant parents, that's like my main message that I always would love to get across to every expectant parent. Of course, there's some times that, you know, but I just feel like there's always, I just, you know, through our experience is always a.
You know, I'll be honest with you. I think, you know, just kind of on like a different note, you know, if other parents who see this or, you know, to get a second opinion, call the professionals, call the people that deal with this, you know, definitely the international, you know, because it's people that have kids of all ages that have been through this stuff. And, you know, I wish we knew about you guys when we were first expecting, you know, to bounce questions off people. And because the 16 week, and I'm not saying anything, you know, about the doctor, and understanding that it's, you know, it's her job to give you percentages and what good looks good and doesn't look good. She really didn't know too much about it, you know, and that was one of the downfalls, because if we just happened to took her, you know, her opinion, you know, I don't know what would have happened. And, you know, we did some research. Thank God we were in the time of, you know, iPhones and internet and Google. And, you know, if this was maybe 20 years ago, we wouldn't have all that at the palm of our hands. And, you know, we were able to find somebody to steer us in a direction. And, you know, all she said was the lung to head ratio was less than 1, and that he had a hole in his diaphragm. So, you know, my wife was, you know, obviously we were all upset. My wife was upset. My mother-in-law, you know, she was driving back from Long Island. And I was just Googling hole in diaphragm, and congenital diaphragmatic hernia kept popping up. And I'll be honest with you, you know, we never heard of it. And, you know, if there's parents that do, you know, hear these news, that you just have to do, unfortunately, you have to do your own research.
I agree. That is very good advice from both of you. I greatly appreciate you guys taking the time tonight to share Ryan's story and to continue to raise awareness in his honor. And we are always here for you guys.
No, we appreciate it.
Thank you again.
Thank you so much. Take care.
Much faster this time.
Yes.
Hey, there we go.
We did it.
Sorry, I thought I was gonna sneeze for a second. My allergies have been crazy.
Oh yeah, definitely. We just got done with the yellowing over here, is what we call it in North Carolina. It just comes so quick, and it covers everything so quickly.
Yeah, it's bad.
Brutal.
That it is.
Really bad.
It's good to see you guys again.
Yes,
You
it is.
too. Well, we have 2 hats for you to sign so far there, Eric.
Okay,
Yes,
I like the sound of that.
Yeah.
Yep.
Yeah. So the people who are fundraising for us with their Facebook, if they reach 1,000, or people who donate are getting 1,000. So we have 2 who have hit 1,000. So we're super happy for them. And I've already started pestering my family and friends to get my fundraiser up because I want a hat too. So.
Oh, well, that's incredible. That is absolutely incredible. I'm so happy to hear that. And I can't wait to sign these hats for these, generous folks. So that's amazing.
Yeah,
absolutely.
They're great. Yeah. And both of these people have CDH survivors. And so that's what an amazing thing, because I want photos of these babies with these hats.
No, that's perfect. And if you wouldn't mind making sure I get the names of whoever they're going to, I want to personalize them and all that good stuff as well.
Absolutely. Thank you so much for doing that. So we have an update on our fundraisers, and we have a little bit of a change. So Mary Catherine is in the first place with 1,075 on her Facebook fundraiser. And then Luna is in 10th place. I'm sorry, she's on her 10th birthday fundraiser. She's doing a combined CDH Awareness Day 10th birthday fundraiser. And she's right behind her at 1,069. So there's $6 separating the two. Those are the 2 who have hats so far. And then Katie is coming up right behind with 910. And she has bumped Jennifer. Jennifer was in 3rd place, and Jennifer now has 827, but I'm sure she's going to catch right back up. So I would dearly love to see all 4 of these fundraisers get hats, along with people who are donating as well. So we're going to, we can't publicly thank people who are donating unless they want us to, because that's, private information, and we'll get in trouble for that unless they tell us. But people who are publicly fundraising, we can say their name. So anyone who donates $1,000, we'll just reach out to them and give them a shout out too. So I think that's even best. You get a shout out and a hat. So you can beat that.
Can't beat it. You can't beat it. And there are very few signed cowboy hats out there from me. I did a couple of them for this charity event not too long ago, but everything else has kind of just been scripts or pictures. And so that the signed hat is kind of a rare item out there. And so I'm pretty excited to be able to do that for some folks. That's going to be awesome.
That is really, really great. So Eric, what are we going to see you in next? For everyone who loves you, is watching this, or who has not watched the show, I bet they're going to be watching the show after they see you here, because you've been such a great, especially the CDH family. So if they haven't seen it, get a lot of tissue, watch the show, some Kleenex, you need it. It just, it's a wild ride, definitely.
That is for sure. It definitely pulls at all the heartstrings, and you're laughing one moment, then you're crying the next, then you're just like, it really is eye-opening and mind-blowing to see what these people actually went through to get across the country on the trail back in the 1800s. I mean, it's just mind-blowing. Definitely, put life into quick perspective for me. And, I'd find myself at times maybe getting in my car and complaining that it's so hot, or, it's not cooling down fast enough. I started doing the show and saw what these people had to go through back then. And basically for 6 months of my life worked as if I was in 1800s. We're riding the wagons, we're doing the horses, the whole thing. And I'm like, I can never complain about anything in my life ever again.
Yeah, absolutely. I know. I was just saying to Dawn the same thing. That time frame for me is like, I always loved it, watching it. Not the cowboy movies per se, but stuff like 1883. Just realizing that like they couldn't even walk away from the wagon because they don't know what any of this stuff is, and then not to speak English on top of it. It's crazy to think that the California's got more people than we do over here. And how'd you get there?
Right.
Originally someone had to cross the trail to get there. And it's crazy. It really is. And the series is so well done that you guys put a real live feel to it.
Well, thank you. Yeah, Taylor Sheridan, who created the show, is his gift is authenticity, and so he really, really, really fights to make everything as authentic as possible, and it shows for sure. And the coolest part about it was, the story takes place in throughout Texas and on the trail, and we were actually filming all of our parts and scenes on the actual trail, and at the where the story was taking place was where we actually shot the show, which is so rare because normally you're on the back of some studio at Paramount and you're looking at the same four walls every day. They just kind of change the sets around. But in this case, we got to be exactly where the story was taking place. So that was really special, and I think kind of added to the authenticity of the whole project altogether. And to come back to your question on what's coming up next, unless it is in the press, I can't really say too much yet until it's in the press, I should say. But I do have three or four movies coming up this year that I'll be shooting throughout the summer and fall, which I'm very excited about. One is a Western, by the way. Nice. And then that's all I'm at liberty to say so far. But there's stuff coming up, and Taylor Sheridan likes to rotate the same actors on most of his projects, which is really cool. He kind of keeps his circle close, and so to be in that family, I'm incredibly grateful for, because he's pumping out content left and right, and hopefully y'all will be able to see me on another Taylor Sheridan show soon.
Oh,
yeah.
Wonderful.
I love that he sticks himself in there like an Alfred Hitchcock, and M. Night Shyamalan always popping in, and I was looking for him in 1883, and then it's like 2 episodes or so in, he shows up in the full beard, and you have to realize it's even him, and you're like, oh, there he is. It's like, where's Waldo? So he does a really good job at inserting himself, but not feeling like you see that it's him.
Right. No, that's so true, and you nailed it. And most of the time, people don't even know that it's him.
Yeah.
Because some people don't even know what he looks like. So it's funny that you'll see him pop in and out. Before he was a writer and a director, he was an actor. He was on Sons of Anarchy and some other shows. So he's got that in his pocket. He can always just kind of place himself in there when he wants to, which is really cool.
Absolutely.
He's very, very talented, and so are you. You did a phenomenal job in that role. I mean, you had me in tears. You really did. And
Thank
for you
you
to be so busy doing, you're at the top of your game right now. You're on one of the most well-known shows out there, but here you are helping us because you're just such a great guy, and we so appreciate you taking the time to help our kids in the midst of all of the things you have going on as well. Thank you.
Well, it's a pleasure. Thank you for saying that. It really is a pleasure, and the more good I see coming from it, the better I feel. And it's all about helping out these families and these kids, and it really is. It's an honor to be here, and there's nothing more important than what you guys are doing. You're changing lives, and you're really helping families who are struggling through incredibly difficult times. So reading a script, working on this, working on that is nothing compared to what we're all fighting here today for. So I wouldn't have missed it. I'll just put it that way.
Oh, well, thank you very much. We kind of have our own strange, sad, sometimes Oregon Trail in the Nicu, a different journey, a different, really hard journey. And everyone has different hard journeys and different things. And some of them are a little bit more roller coaster, like CDH or like show, or like, the story behind the show. And it's just, the thing is, we just keep plugging forward, looking up and tackling one thing at a time. So we're so happy to have you here, and I'm rambling, so I'm going to stop.
It's been a long day for y'all. You have been going hard since first thing this morning. So the fact that you're even able to formulate sentences at this point is mind blowing to me.
Next year it's only an hour. No, I'm just kidding.
But we have a great team behind us, and Melissa runs awareness. Melissa Reeves, she's done a phenomenal job with the team this year. We've had so many people helping with all the light ups and the graphics and the social media, and Tracy interviewing everyone. So it's really been a team effort. But yes, we're running on steam because we've been going, trying to get everything going. And then we have the biggest CDH conference in the world is happening next week in Scotland. So we end this tonight and we're on a plane tomorrow. We're on a plane tomorrow. So but it's a good April for our kids. It is.
Amazing.
Dawn's hiding her cape, by the way. It's on there. I keep telling her all the time. It's on there.
I'm convinced. I am convinced there's some superpowers going on right now. Yeah.
Tireless effort is what she brings.
Just moms, we'll do anything, so.
There is a primal, instinct that comes out in mothers who are fighting for what they want and what they believe and, for what's right. And it's an amazing thing to see. Truly. It's the powers that can come out of some people. It's mind blowing. Now, is the conference in Scotland, has that been an ongoing, conference that's happened for many years?
They started the same year we did. It happens every 2 years. It just so happens to happen in April this year and in Scotland, and it's in different parts around the world. And all the CDH experts from all around the world come and present their research. And because we run the patient registry, we present our research as well. So it's been a wonderful journey becoming part of that group and having a seat at that table so that our kids have a voice and that we can offer something to research as well. Data is very important to help us find the cause of prevention and best treatment to CDH. And so it is a very big deal. And Jason, who is adding up the numbers today and got us really excited, is much better doing numbers on our registry, on our data. So he is presenting also. So we have a great team. We really do. Everyone here wears capes, and there's a lot of love for all these kids. It really is.
Oh, that's so great. That's so cool. And I'm so happy to hear about that conference. It seems like there's a lot more people fighting and creating wonderful organizations to help better this and to help better these families than I expected. So I'm really happy. Are there other conferences as well, or is it kind of that one main one? And
that is the main one for CDH, but we go to a lot of research conferences around pediatric surgery to present our research. And then rare disease, we're very active in the rare disease sector as well, because technically CDH is rare and it's a disease. So we try to make sure that those kids have a voice at every possible table. We walk through every door that opens. We figure a way to make it happen. We do all of the things that we do. You've seen all the crazy things that we do. And we have thousands of families that we help, thousands of families in this registry, thousands of families that we have served in 84 countries on $250,000 a year. We do all of that. That is why you see the tech support, the logic is so great. It's so wonderful. Yeah, we do. We can stretch a penny here, but we make it happen. We do whatever it takes. And so, yeah, we're really proud of all that we do, but there's so much work that still needs to be done. Researchers need to get paid. They can't do the work for free. And we work with a lot of amazing universities and labs around the world, a lot of hospitals, and there's a lot of work to be done.
Yeah. Wow. Well, no, it's incredible. And, although it's been 28 years, it seems like you said, it's just kind of the tip of the iceberg.
Yeah.
And hopefully there are some young advocates out there who see what you're doing and maybe one day strive to kind of, take over or fill your shoes or, help right alongside you. Young people are, this generation, there's just so much available to them and so many wonderful resources to be able to tap into so easily. It's, I'm inspired by, this generation. I think they are going to make some big changes because there's a lot of awareness. And I just know someone out there listening or watching is going to be, our next superhero cape wearing leader and or, a part of the family of helping this grow. So hopefully this inspires that as well.
I hope so. I would love to retire someday. I would love to hand the mantle over. I mentor anyone who asks. We just want good help for these kids, good help, and to save some lives. That's it.
Yeah. No, it's amazing.
Well,
let's learn about some more of these kids.
Love
We'll
it.
see you soon, Eric. Thank you.
Okay. Thanks, guys.
All right, see ya.
My name is Ian Meets. Almost 17 years ago, I was born with a congenital diaphragmatic hernia, and I am a survivor. Please donate to CDH International today.
Here's something you may not know. April 19th is Congenital Diaphragmatic Hernia Awareness Day. 1,600 kids are born with CDH in the US every year. Did you know this? So, it's Michael Weatherly, hi, from television's Bull and NCIS Bull. That's my polar bear. I just wanted to be a part of this small charity of moms and dads trying to fight the good fight to raise money and awareness for this birth defect. And there is a website, cdhi.org. You can check it out. It's an awareness that, as of lately, not even I was aware. And so, do your investigation, your research, check it out, and see what you think.
Hello, everyone. This is Bernard Bullen. You might recognize me for being Din Djarin's father on The Mandalorian Season 1. I hope you watched Season 2. It's been amazing. But I have something very, very important to tell you. The month of April is Global Congenital Diaphragmatic Hernia Awareness Month. And for whoever is suffering for this illness or have families or very close ones who suffer this, they know very well what I'm talking about. I'm going to ask you for something very, very special for me. Is for you guys, girls, mothers, fathers, everyone. I want to encourage you to participate in fundraising, whatever you can. Raising awareness, share your stories, or donate to our telethon. You can learn more about it in www.cdi.org. I repeat, www.cdhi.org. And there you can know a lot more about this illness and what is causing in a lot of people that are suffering. Yes, we are in a pandemic, and it's very, very, very sad and very important. But there are still a lot of illnesses and a lot of suffering people from other things that it seems like it don't matter. And this does matter at all. Congenital diaphragmatic hernia. It's a really, really, really important illness that is happening to a lot of people. So please, I aim you to donate whatever you can. $5, $10, whatever it is. I am donating myself, so you know, and you will make a lot of difference and happy a lot of people if you can help. So happy 2021, everyone, and I really hope that even sharing your stories, like I said before, because it's really important that we can contribute to make some families or some people a bit happy. That is the way. Thank you so much.
Shannon, would you like to introduce yourself and tell me a little bit about what life was like before you heard the word CDH?
So my name is Shannon, and before we knew about CDH, I didn't have but one child before, and he was a healthy kid. So I'd never heard the term CDH in my life until I got pregnant with Nathan. And during the pregnancy, they noted bright spots in his abdomen area, but they just called them focal, something focal. I can't remember the term now. And they kept trying to test to see if they could find a cause, and they could not. So they decided, it was nothing to worry about. And then he was born, and he was struggling to breathe, but he was born at 34 weeks. So we chalked that up to the fact maybe he's a premature baby and he's struggling. And Nathan was born with Down syndrome, so he had low tones. Maybe that added to that. Really, he went through a lot of difficulties in his first 3 or 4 months, and they could not understand why he would not grow, why he was not gaining weight, what was happening, why he was struggling so much. He'd spent a month in the NICU, and we had taken him home, and he just kept struggling. So they sent him in for randomly to do an upper GI to see if he had some kind of motility issue or maybe something going on with his intestines. And that's when they noted something immediately on the test, and they kept pointing at the screen, and they didn't stop me from leaving, but I left the hospital, and as I was walking in the door at home, my pediatrician called and said, "Are you still at the hospital?" And I said, "No, I mean, we left. They said we were done." And she said, "No, you need to go back." I'm like, "What do you mean I need to go back?" And she said, "They think they found something that's very uncommon and it's serious." Okay, so the surgeon called and wanted to see us. Then I took Nathan in, and they did confirm that he had a diaphragmatic hernia, a morgagni, and that he would need surgery. And we did have surgery. For Nathan, the wall opening was allowing his liver to protrude into his chest cavity, and behind it were his intestines. So they were very concerned about the strangulation of his intestines. That was a big part of why he was not growing, because everything was coming back out from all the pressure. He was able to be weaned off oxygen, so he did okay. But we had surgery, and we had 3 surgeries actually. We had his first one in December, then we had one in the end of January, another one in February, and he had a lot of complications, just really strange complications. And then we got through that, and we thought, okay, so
were all 3 of those surgeries related to his diaphragmatic hernia?
They were. His body was rejecting the stitches that they used internally, and he literally they were trying to come out through incisions, and they'd never seen anything like it. So we had med students taking pictures of this to say, "What is this? This is crazy." And the surgeon came in and he said, he was the head of pediatric surgery. He said, "I've been doing this for 30 years. I've had maybe 10 kids with CDH, maybe 10. Never seen this happen before, ever." So it was very uncommon. They wanted to go in and open him completely up and take out every stitch they could see and figure out a new way to repair that abdominal wall where he was open. And so there was really a lot of complex conversations about what do we use, because they use silk sutures, which are supposed to be hypoallergenic, and apparently his body does not like them. It was really a very strange thing. So we had to go through that for a while. He still struggles with that sometimes. Sometimes we'll see issues. but he did okay. He had to have a G-tube for feeding. And then about 2, we were able to wean off of the G-tube. And then by 3, he started to lose his hair. We're like, what is happening? You know, he's not growing. He's not been growing. He's still really tiny. I mean, he looked like he was 18 months old. And so we thought, okay, this is really strange. And I kept asking them, what's happening? Because I feel like this is a GI issue. And they kept telling me, no, it's not. It's not. It's a Down syndrome issue. And I'm like, no, this is not. And we started down this path with his pediatrician with the hair loss, just little patches. And she said, well, it can happen. Let's check the thyroid, because sometimes it's tied to the thyroid. The thyroid levels were crazy. So he started on Synthroid to correct that and was sent to endocrinology to follow him. And she was the person who first found that all of his inflammatory markers were elevated. And she said, now you have to go to GI. Mm-hmm. And they were like, oh, no, this is not a GI issue. And I'm like, well, it's really strange that you say that, but she agreed to do testing. And through that testing, we went through immunology, 2 immunologists, actually, 2 pathologists, 2 GIs at different facilities. And finally, they decided he has Crohn's disease. And we do wonder, because they have not tied, I think there's been one child tied to CDH and Crohn's disease. Nathan was very early onset irritable bowel disease, and there might be a correlation between the fact he had his intestines involved with his CDH. So there is some question, and it's not being well studied because it's not been very common. Mm-hmm. So Nathan is one of those rare children who have now he had very severe Crohn's disease at 5 years old, and immediately went on to biologics, which are the strongest drugs they can use. And we're watching now to see if there is any kind of correlation, but there's really no one to figure out how those 2 things tie together. But we feel very strongly that there is a correlation between the 2.
Mm-hmm. Mm-hmm. And how old is he now?
He is 6 now. He's been out of remission with with Crohn's one time, and he is having scopes this actually Thursday to see where we are. Biologics are really strong, and they carry a lot of their black label drugs, so they carry a lot of risk. Because he was under 5 when he was originally diagnosed by a few months, we had to get special approval to use the drug, but because he was severely ill, he had inflammation that caused granulomas in his intestines. So we had to go to the strongest possible drug for him. He's really struggled. He's had a lot of struggles. He had to have a G-tube again last year. Mm-hmm. And then we had 2 months of infection that led to 8 weeks of hospitals and multiple tests to make sure the infection wasn't in the internal organs. And it just has been really one thing after the next. And we think, okay, we're through one big hurdle, and then something happens again. So they do watch his repair. Every year they x-ray him to see if the repair is still intact. Mm-hmm. And there is a lot of, unfortunately, sometimes doctors don't realize how important it is to continue to watch to see that those repairs are still intact. So I have to remind them yearly, we need to check this out, because if you don't, they're like, oh, we fix that. That's not a big deal. And we know that he can reherniate at any time, unfortunately. And you definitely have to advocate. It's a total advocate job to be a mom of a kid with congenital diaphragmatic hernia and then with Crohn's disease. It's so much, but I think that most people don't even know what it is when I say they think it's just a little hernia. I'm like, no, it's not a little hernia. It's a major issue that affects lungs and hearts. And for him, his liver was fine, but his intestines seemed to be affected. So it's a very strange road, and it's really difficult to explain to people how different this is, because he can be very healthy one minute and very sick in the next. And that's what we've seen over 6 years. Very healthy and then very sick.
And does he comprehend what's going on, or does he ask questions or talk very much right now?
He talks a lot, actually, but he's very against anything medical. In fact, yesterday we had COVID testing to have surgery this week, and he had a complete meltdown the whole entire drive. I mean, total disagreement, crying, screaming, crying. He's not doing it, begging me not to take him. He does not like anything medical because he's had a lot of medical trauma. And when he wakes up in the hospital after anything, he will not even have his eyes fully awake, and he will be sitting up, pulling off everything, oxygen, leaves. He just will take it all off. Yeah, he's done. I'm done, and he will not eat or drink until he can leave. And so we've had, over the years, they've learned he's not going to cooperate unless you let him go home. So we'll get to the car, and I'll say, do you want to eat now? Yes. But he definitely will not. He is not a fan. He has very much learned when we're going to the surgeon's office to just pull. He automatically pulls his shirt up, like, I know you want to look here. So immediately he always thinks that every single appointment is going to be to look at his belly. So it's actually kind of cute. We can just go in for a regular pediatrician appointment, and he'll pull his shirt up, and I'm like, yeah, we don't have to do that. So I can only imagine at school what he's gonna do. He'll probably show everybody his belly. Be like, hey, you want to see my belly? Come here. Yeah, he's got the scars, so I think he kind of knows they're different, and he's sort of like, what is this?
Right.
He doesn't seem to care, but he does notice it.
Right.
But yeah, the trauma for Nathan has been really hard. The trauma of going through so many medical procedures. He doesn't trust them. So, and children, you think they'll kind of get over that and begin to understand we just have to do it. Not Nathan. He is not a fan. He's like, not happening, Mom.
Oh,
not happening.
Boy.
But it's so crazy to me that no one ever even thought when he was born to do any testing, because he was aspirating everything, that no one ever even thought to check any kind of, like, should we pursue this further? There was absolutely nothing done in the NICU. Just nothing. And I think back and I thought,
how long did he spend in the NICU?
So he was in the NICU he was there for 1 month, and when he came off oxygen, he had a lot of D-stats that they wanted to put him back on oxygen because he was struggling, and they could not understand why he continued to struggle. He would do okay, and then he would D-stat, and they would say, respiratory would come in and say, well, maybe he needs the help. And no one ever thought to see, is there another reason? Something else going on. His was literally caught by accident. It was total accident that they found it. And I can't imagine what would have happened if we had not just had an upper GI series done and they found it. And it was so crazy to me that no one could ever put together, even during my pregnancy, that there was a problem. They kept saying, well, we've never seen this before, so what could this be? And when I think back, I'm like,
had they diagnosed you with the Down syndrome prior to birth?
they did. But even with that, we found out at 14 weeks. But even with that, they still had never seen this abnormality, and they couldn't figure out what it was. And I kept thinking, that's very strange that you were high risk medical, and they had no clue what they were looking at. And I just wonder now if it was something if they had known more about, if they would have been able to diagnose him before birth or even at birth, but no one ever looked at that. So he had a great struggle initially, and then he had a great struggle a couple of years later. I mean, he really has had kind of like a roller coaster ride.
Sure he has.
So we're just going right along with it. I mean, we really are. We really hope that some kind of study comes out of this so we can see if other children are struggling with irritable bowel disease. It'd be interesting to know, honestly, how this affected other kids as well. And I don't know if people even think about the correlation between the two. We did an interview with CHOP to see what they thought, and they said, oh, there's a high probability that this is correlated, but then our local hospital, they're not really interested in studying that out. So we're like, oh, that's interesting. But I would really like to know how long term this goes.
Definitely participate in the CDH patient registry, get that information out there for Nathan, and maybe we will find that there's other kids like Nathan, that has the same complications and issues that he faces.
Yeah, I would love to do that. I think that that's going to be really important too, and knowing if there's a different way to treat our kids versus, just children who have only irritable bowel disease, because it's interesting that his intestines were largely affected, and then within a couple of years he has such great issue with them. So luckily he's been able to keep his colon, and we haven't lost anything at this point. So that's kind of our hope, that we have a long time without having to ever face that. Maybe we will never face that, but those are just sort of the risk that we have to take now.
Right. That must be difficult for you and for him. Tell me.
It is always really, go ahead. I'm sorry.
No, go ahead.
I was going to say, it's always really difficult too, because, treatment for him is for life. For Crohn's disease, it's life. And he'll always have to have treatment. And the average for this drug to work, pretty much the longest it works for someone, is 12 years. And since it's the top level drug, there's not a lot of options. So it's sort of like, well, what would be next if this didn't work? And we're hoping that we don't have to find that out. But there's definitely a lot of hesitation with every time you go in to have testing. Like this week, we're sort of like, let's just hope for good news. But we suspect he has some things happening just based on his symptoms again. So we'll see.
Okay. Well, we'll keep him in our prayers, and we hope that he gets some good test results. Tell me a little bit about, was he your inspiration to expand your family?
Oh, of course. Nathan came after 17 years of infertility, so he was sort of a surprise baby. When they told me I was pregnant, I told them there was no possible way I could be pregnant, and I was 7 weeks pregnant at the time. And when he came along and we found out he would have Down syndrome, the first year going through all the surgeries, having any more children was not on my mind. But as he got to a little older, I thought, he definitely does not need to be alone. And he's going to need some friends and some people to play with. And so that's when adoption came into our world. And then adoption became 2 children, and then 3, and now it's 6. And so there are 7 little children in my house. They're all 6 and under. It's insane a little bit.
And they all have Down syndrome, is that correct?
Yeah, they all have Down syndrome, and they're all from Ukraine. So we have a very strong tie to Ukraine, and all 7 of them have Down syndrome. And it's very good, honestly. Nathan's my only CDH baby, because they've learned so much from one another.
Hey everybody, it's me, Dee Snyder from Twisted Sister, and CDH International made me aware, and I'm making you aware, that April is Global Congenital Diaphragmatic Hernia Awareness Month. I did not know that, and quite honestly, I didn't know what CDH was. So I went online and I researched, and I discovered this is a serious, significant thing, and I have actually had a brush with it. I don't want to trivialize it with my small issues, but just saying one of my sons was born with a herniated belly button that had to be closed up because it's an opening and that allows intestines to protrude. Some children, some babies are born with a much more severe case and much, much, much more severe conditions as a result. So I want to encourage you all to support fundraising efforts that CDH International is doing. I want you to get the word out. I'm Dee Snyder. I had a little bit of a brush with this thing. You think I would know about it? I did not. Going online, I discovered so much. And thank you, CDH International, for making me aware of this important cause. And we got to get people to donate to the CDH International Telethon. All right? You can find out plenty more information at cdhi.org. cdhi.org. I'm going to go there right now.
Hi everyone, we're back really quickly, me and Dave. So we have an update on the money we raised. We are just a hair shy of $20,000. We cannot.
Yeah, we can't fall just a hair shy of that number.
No. So if you've been holding back because you've been at work all day and you want to wait till you get home to ask your spouse, hey, can I donate, a big check to that great children's charity to help those kids?
Absolutely.
Now it's time to do it. Everybody should be home and watching the telethon, at least on the East Coast. On our West Coast, they're still busy. And we're going to be live on the West Coast right before we close because we're going to do a live interview with the family and they're going to be a light up. So we're really excited about that. But we absolutely cannot end this telethon until we hit at least that limit. But I think we can do much better than that. So, right?
I don't see why we couldn't.
Yeah.
Who wants a hat? I mean, giving away some hats.
Yeah.
I mean, personalized, signed.
Well, but really, who doesn't want to help kids? I mean, who doesn't want to help these kids? Have you seen these pictures and these videos?
Absolutely.
I mean, it doesn't tug at your heart. And
Sharon has 6 kids now because of one started. So think about that.
Yeah, an angel on earth. And she's helping more babies in the Ukraine in the middle of all of everything that's going on. And that's the type of families that we serve here at CDH International. These incredible, giving, loving, strong, amazing people with these children who just inspire incredible acts. I mean, they're just phenomenal children. And we're really blessed to know them and to work for them and to be here with you trying to raise some money and awareness. So I know it's been a long day. It's been a long day for us, but we're here and we're doing great and we're raising some money, but we can do so much better. So let's try to hit that 20,000 mark before the next break. Is Eric back in the next one? Not yet.
Not yet.
Yeah.
One more-ish.
Yeah, we're going to get him back soon. But not yet. So when he comes in, I want to be able to tell him we have 5 hats, 10 hats, 50 hats. I want to send him a truckload of hats to sign with all sorts of great personalized autographs and loads of pictures coming in of people wearing the hats and raising some awareness and telling people how they got the hat.
And if you've been watching, he's super excited to sign them. He was very excited to find out names already. So he can't wait to personalize, and thank you for, pushing and getting those donations in.
We are really grateful to have Eric on the CDHI team helping us today, and he's stuck with us now. We adopted him. He's not getting away. So, Dave, you have any other updates you want to?
I don't. We have been very quick to update with as much as we pop in to keep you guys informed. Just keep sharing your links, especially now that it's evening on the East Coast and folks are hopefully getting off on the West Coast. And just keep sharing and getting that story out. We are here for another 2 hours-ish on the East Coast. So please keep pushing. And bringing that support.
Yeah. Oh, the Angel Club. We really need to talk about the Angel Club more. So it costs about $40 to mail each tote bag now because postage costs have really gone up, and even flat rate shipping for these tote bags, postage has gone up. So if you join the Angel Club and you donate $20 a month, that is what? 4 trips to Starbucks, right?
Yeah. You might have actually saved money.
Yeah, you will save money.
Yeah, no doubt.
If you give up Starbucks for 1 week, just 1 week to help some kids, that is 6 families that are going to receive hope in a box. Literally, we call it the CDH Hope Tote Bag Project for a reason. Just because you don't drink coffee for 4 days, or make it at home,
And it's automatic. It's secure. It's super easy to sign up for. I think it's like 7 total lines, and it's there, and you're giving, and not that you forget about it, but it's nothing you have to do to keep giving. And those are the donations that we need to know they're coming in, so we can maybe jump out on faith a little bit one time and say, well, we know it's coming. The month's almost over, and the new rain's coming in. So the Angel Club is definitely where we need as many people to sign up for. And if you can't do the 20, whatever you can give on that reoccurring, it makes a difference. Dawn and everyone here, we can stretch the dollar. We learned to love to stretch the dollar as much as we would personally as we do for the charity. But we can make that dollar or 5 or 10 or 30 go extremely far. And you can see on our website what we do with it. We're very transparent in what we do. We don't have any money in different areas. It all goes back as much as we can give, and still keep these lights on, from that point on. So you know what you're giving is going to make a big difference.
Yeah. We not just keep the lights on, but we continue to serve families through pandemics,
Yeah.
through all sorts of things. And we are extremely transparent. All of our IRS forms are on our website. We put out our full financial things. You never have to guess. We're an award-winning charity. We won a presidential award. We work really, really hard for these kids because we want to make them proud. And part of making them proud is helping them in a positive, transparent, loving, wonderful way to do the best we can for them. So, and a lot of people donate $1 a month. And I've been an Angel Club member for 10 years, for a really long time. And honestly, I don't even think about that money. It just comes to the charity to help these kids. And if I can, send a tote bag out a month, on top of the other stuff we do, the volunteering, we love these kids. So we do whatever we can. But, I have family members that are Angel Club members and friends.
Everyone in my family is an Angel Club member. Yeah. It's an easy way to give. And they do it in the name of Braden, our son. But it is an easy way. And you don't feel like you're every year hitting them up. Hey, it's another, a time to donate, because they're already doing that. So it is a nice way to constantly give the support that we need and these children need.
Yeah. And if you've never heard of CDH before now, and you don't personally know a child born with CDH, but a story that we've shown tonight touched your heart, donate and honor that child. Or Braden, his son, or Shane, my son, or just to all the children, Just give as much as you can because these kids need us. They really need us.
Yes, they do.
Yep. All right. We'll see you all again soon.
I'm Maria from Greece. I'm a mother of one healthy boy and two CDH girls, non-survivors. I was diagnosed with left CDH during my B-level anomaly scan in 21st week of my second and third pregnancy. In 2014, I developed polyhydramnios and intrahepatic cholestasis of pregnancy. On 38th week, I gave birth to my baby girl, but she died the next day. In 2019, my new embryo girl had also left CDH, but I was induced and terminated the pregnancy. I hope the research finds the cause of CDH.
April 19th is Global Congenital Diaphragmatic Hernia Awareness Day. Over 52,000 children are born with CDH every year. Only 50% survive, and the cause is unknown. CDH International is the only global charity fighting for these children. If you would like to help by donating, please visit cdhi.org. Thank you.
Hi, I'm Marilyn Rice-Cub. April is Congenital Diaphragmatic Hernia Awareness Month, and April 19th is CDH Awareness Day. 52,000 babies are born with CDH every year, and over half do not survive. Please donate, raise awareness, watch the telethon, and help those kids. cdhi.org for more information. Thank you.
Hi, I am here today with Jessica. Jessica, would you like to introduce yourself and tell us a little bit more about yourself?
Hi, I'm Jessica Cummings. I had a CDH son, Nathaniel, in 2011. He was diagnosed at my 18-week ultrasound. They found his stomach next to his heart. And so they took us in to meet with genetic counselors. I believe they scheduled an amnio. We went back for that, and everything came back normal. So I feel like they maybe pushed us aside and said, hey, you know, he has CDH. We don't know what the survival for him will be. You can do tracheal occlusion. You can terminate. Let us know what you want to do. So I ended up doing a lot of research myself. I had found Cherubs. They were pretty much the only CDH charity that was really interested in talking with me. We decided, I found two places that I could do tracheal occlusion. We told McGee that we wanted to do that, and they said, all right, great, we'll get all of the medical records together, we'll send them out. And we weren't sure if we wanted to go to UCSF or Brown, so we ended up meeting with both. We were accepted in both. We are located in Pittsburgh, so we decided we were going to go with Brown. It was more of a smaller hospital, and the people there were really nice, and it was closer to home. So we figured people could either fly out or take a train out and visit while I was out there. So we went out there. I believe I was 24 weeks. My cousin and my husband came with me because he was going to stay for the tracheal occlusion and then fly home, and my cousin was going to stay and help take care of me because you have to stay out there. And we did an ultrasound the day before the surgery was scheduled, and they found that his lung to head ratio had gone from, I believe it was a 0.2 to a 1, and a 0.2 I think gave us like 20% chance of survival. and the lung to head ratio of 1 gave us 50%. And they don't usually accept patients with a lung to head ratio of 1 or higher because there's so many risks for the surgery. So they pretty much told us, you can't have the surgery, send us home. So we decided that we were going to stay and deliver at Pittsburgh because it's a great hospital. It's close to home. They have ECMO because we knew chances were he was going to need ECMO. So I stayed home, delivered him at McGee, and then they took him by ambulance. It's only a couple miles to Children's Hospital. And I believe his O2 levels were pretty low. So as soon as he made it to Children's, they put him on ECMO. Let's see, am I leaving anything out? I don't think so.
Did you have any pregnancy complications with him at all?
I had none with him, ironically. I have 3 living children, a 12-year-old son, an 8-year-old daughter, and a 4-year-old son. And their pregnancies, there was a lot of bleeding. I had pretty much with all of them, I had hematomas. My pregnancy with Nathaniel was totally normal, other than him having CDH, which is very ironic to me. So
tell us what the day was like when he arrived.
So they had scheduled an induction for 39 weeks because they wanted to make sure maternal fetal medicine was there and all the doctors. Of course, it was the room was full of doctors when he was delivered. Pretty much normal birth. He came out. His APGAR was a score. I can't remember exactly what it was, but it was actually pretty good. And I was surprised by that. So they intubated him, and I guess the tape was wet, and they ended up trying to show him to me, and they had to re-intubate him because everything came out. So I really only got to see him for a few seconds, and then they rushed him out to the NICU where they stabilized him and then sent him by ambulance over to Children's. But yeah, the birth with him was pretty uneventful. And then they told us that they were stabilizing him, sending him by ambulance, and they told us it would probably take to get him stabilized and sent over about 2 hours before my husband would be allowed to see him in the NICU over at Children's. So that was actually my biggest fear there, was making sure that my husband would be able to make it over because I was stuck in McGee. So I made him leave immediately. I'm like, I don't care, go wait at Children's in case something happens, he'll have someone there. But no, he did great. I believe it was 10 days on his first ECMO circuit, and then it started to have clots, which I guess is 10 days is like about average for a circuit from what I know. So they decided he needed his circuit changed because they tried clamping him and he was failing. His pulmonary hypertension was too high. So they ended up switching circuits, and they told us a lot of kids do terrible. So it's going to be a lot of steps backwards because you're essentially replacing their entire blood. So they have to get all of the medications back for them to be working correctly. And he actually did perfectly fine. Like there were no issues. He was able to, go from one circuit to another. They had to adjust his meds a little bit, but he did fine. And then he was on the second circuit until I think it was around 21 days. And then they said, we don't, it's not, his circuit's starting to fail. You're starting to get clots. And we debated on whether or not we should put another circuit on. And from what we were reading, if you've been on ECMO, and this is what we knew, in 2011. Things have probably changed now. But from what we were researching, if you're on ECMO for more than about a month, chances are you're going to have more complications. It's going to do more harm than good. So we decided, you know, we would take him off ECMO and see what he could do. He didn't do terrible for the first few hours. And then his O2 would drop. So they would switch him to the oscillating vent, which could bring his O2 back up, but he couldn't get rid of the CO2. So then his CO2 would be too high. So they would switch him back to the normal vent, and the same, his CO2 would drop, and that, but so would his oxygen. So it was, I think, switching back and forth from the regular vent to the oscillating vent. I think we did that 2 or 3 times. And I remember at one point the nurse had to change out some medications. And we saw her just, you know, looking sad. And we just knew, like, he's not gonna overcome this. So we pulled him off of the vent, and I think he lived for about 10 minutes.
He fought so hard.
He did.
What a precious boy. Was your family with you, or was it just you and your husband?
They were. After we took him off of ECMO, I believe my husband's parents were there. My parents were there, my brother and sister, and her husband came down. So it was actually really nice that everyone
was able to love on him and say goodbye.
Yeah.
Oh, I am so sorry.
Thanks.
Sweet boy. How were the days and the weeks after saying goodbye?
It was a little rough.
How old was your son at the time? One at home?
He was 22 months old, so just shy of 2. Of course, he didn't understand it. While when Nathaniel was in the hospital, we had stayed at family houses, which are like the Ronald McDonald House, but we didn't make the qualification to stay in the Ronald McDonald House. So we stayed at the family houses, which were local. I believe we stayed at the one in Shadyside, so we just drove over. So we stayed at the family houses. We stayed at the one in Shadyside, which is a couple miles away, and then every morning we drove out for rounds, and I believe they started at 8, and they always started with the sickest kid. So obviously anyone on ECMO. So I think there may have been one other child on ECMO while we were there. They came on later. And it was a little girl. Okay, go ahead, go. So we would come over so that we could be there for rounds and hear them talk about what their plan was for Nathaniel every day. Dom, like I said, was almost 2. He was staying with my parents, so every other day they would come down to the hospital, bring him down, see Nathaniel, and Dom thought it was the greatest thing because there was all kinds of, they have fish tanks and trains and stuff at children. So he thought it was fun. He didn't understand, and we would take him in to see his brother, and he didn't really understand. He would, I remember him saying, "Oh, we done? Okay." Things like baby sleeping. I'm not done. Yeah, you're not done? Okay. I'm just getting something. What are you getting? A drink. Okay, go ahead, get your drink. Okay. Sorry.
It's It's fine. They're cute kids.
Thank you. Thank you. They're crazy and very inquisitive.
Oh.
Lost my train of thought. So we would be there for rounds in the morning to go over what their plan was for him. And it was actually kind of funny because a lot of the doctors were pushing for him to have his repair surgery, but a lot of the surgeons were pushing. They wanted him more stabilized. There is a straw.
But it's attached to it.
No, it's not attached to it. There it is. So the surgeons wanted him to be off ECMO, of course, because of bleeding risks. But a lot of the doctors, the Nicu doctors, wanted him to have the surgery. So it was almost like not a battle, but you know, everybody. I've learned that in medicine that everybody has their own opinion of the right way to do it, which changes. But I mean, that's science and research. And
Right. So he never did have his CDH.
he never did.
repair.
No.
Never did.
No.
So you have been with us for many years, volunteering different positions within the charity.
Yes.
How important is it for you to still continue to raise CDH awareness and give back?
I'm sorry, I didn't hear that.
How important is it to continue to give back and to continue to raise CDH awareness?
Oh, I love it, and I did so many fundraisers. I did painting parties, and I threw a dinner dance, and I think it is awesome to get money to CDH research because since so much what wasn't known about it, and we're just now, it's now looking more important. Not that it wasn't, it's always been very important. But now I think a lot of, I say labs because I worked in the lab, but I think a lot of people are now saying this is something that does happen pretty frequently and we know nothing about it. But I really, because my kids have gotten older and the 12-year-old is in Scouts, he loves it. The 8-year-old is in gymnastics, and we just started competition, so that has taken up a lot of time. 4-year-old just started preschool, so it has been crazy, and I haven't been able, like, I'm just trying to figure out how we function daily. And I find it funny because I remember when I was younger and my parents would always complain about all the chauffeuring they had to do, and I was just like, oh, Mom, Dad, you're just lazy. It's just like, no, it's a lot.
It is
it's a lot.
It is a
so
lot.
I wish that I could actually do more now, but I'm trying.
You're doing wonderful, and we appreciate you.
Oh,
and
thank
there'll
you.
be that day when the kids are gone and you want something
more
to do. We are here for you. We're here, and you always have a place. We always appreciate you raising awareness and Nathaniel's memory and keeping that little boy's memory alive. Do you guys do special things on his birthday?
We usually just go out to dinner, and we'll go to the cemetery before, and then go out to dinner. And we baked a cake because my kids really wanted to bake a birthday cake, and I'm not a big baker, but they were excited about it, and there were a lot of sprinkles, and it was, and we usually do what are those things? The little Chinese lanterns, I think they're called. We release those, and
that's precious.
Yeah,
it's precious. So what advice would you give to a CDH family that's just beginning their journey with CDH and getting that diagnosis?
Oh my. Well, I would say you have to do a lot of pushing for what you think is best in your situation, because I don't think there's going to be, there's not a perfect plan, because CGH is, there's so much unknown about it. And while we do have some hospitals swear that, oh, we're the best CDH hospital, and others don't really know anything about CDH, I think you have to factor a lot of things into it. You need family support. And I'm not saying that you shouldn't travel, because you should. There really are a lot of really good hospitals that know about CDH, but you need your family and your friends there, and even other CDH parents that have been there. And sadly, you have to prepare for every single possible option, because there's going to be a lot of things that are thrown at you that you weren't expecting, both good and bad. I mean, there are some crazy things that happen, and I know a lot of, not personally, but I've been in contact with a lot of CDH parents who were pretty much told their child wasn't going to make it, like running around crazy kid now. But sadly, not all of them make it, so you have to prepare for that too.
Thank you.
Be ready to expect the unexpected. I don't know.
Yep, that's very true in this journey. It's just a roller coaster of a ride for sure.
Yeah, it's crazy.
Jessica, I can't thank you enough for sitting down with me today and sharing more about Nathaniel and his life. And I appreciate you more than anything for being on our volunteer team and continuing to give back.
Thank you.
Hello there, Melissa Etheridge here. April is Global Congenital Diaphragmatic Hernia Awareness Month. And CDH International wants to encourage you to participate in fundraising and raising awareness and sharing your stories and donating to their telethon at cdhi.org. So please go to cdhi.org and see what you can do. Thank you very much.
Hey man, what's happening, y'all? My name is Christopher Reed. I'm known as Kid from the group Kid and Play. And I'm here today on behalf of a very, very worthwhile organization, CDH International, trying to help people that are in a lot of pain right now. A lot of pain. Also want to remind you that April 19th is Global Congenital Diaphragmatic Hernia Awareness Day. So CDH International is trying to help people. They want to raise awareness. They want to raise money. They want people to share their stories. A lot of times, you know, that's what really helps us get through these tough times. So go to cdhi.org. You can get all the information that you need. These days are so crazy, y'all. And people are in a lot of pain, and sometimes more pain than you even realize. So go to cdhi.org, get the information. We can help one another, and we'll get through this. Okay? All the best. Much love.
We are so grateful for the celebrities who have given us their time and their talents to make those videos and to ask about CDH, and to really, some of them have done a lot of research before they did those 30-second commercials, because they wanted to support a good cause, and this is a great cause. And Chris just did a great video for us, and we appreciate him. And nice guy. So many nice people. We really work with a lot of nice people every year to put this together. And next year will be even bigger.
Yes, it will. We'll get more folks out there to join us, and hopefully we can continue to go as smooth as it is going right now for us.
And Eric has promised to come to North Carolina or somewhere.
Yeah, we promised to either meet him somewhere, him come here. We haven't figured out yet on the steps of DC. We don't know yet. Who knows what we're gonna do? But it might be big. Might be bigger than you expect. Who knows?
Yeah, but it's a year away, so we have time. But you know what also takes time? Getting proclamations. Have you seen all the proclamations this year for your CDH family? So if you're just tuning in, we ask governors and mayors for proclamations for CDH Awareness Month for all of April, or CDH Awareness Day, which is April 19th. And we have had a great response this year, especially coming out of a pandemic where so many offices were closed. We had a year or two where it was really hard to get anything done. And we really accomplished a lot this year because we have a great team on the awareness side. And then also we have a lot of light ups going on, and that takes time as well. And we have people asking us to light up places. And so help us. Ask for a proclamation next year, help with the light up. And you don't have to have a CDH baby to participate. We would love anyone's help from anywhere, not just in April. You can volunteer anytime. We have a lot of volunteer positions open, so you can help in many ways. If you can't make a monetary donation, make a donation of your time. That helps these children also. So we're really grateful for that. And Dave, remind me what we were talking about.
The new ending to our
yes.
We have created. We've tried to create a little fireworks ending here. For the telethon. So we're going to combine a bunch of things. We're going to take our last family interview and make it live at a light up in California.
Yes.
And we're also going to bring Eric on with us as well.
Yes.
So we're going to have a story being told live at the light up, which is an amazing on its own. And we appreciate Francisca, on the fly saying yes to that. And of course, Eric didn't hesitate to come early as well and be with us longer, as he has done all day, has done whatever we've asked. Like Dawn came up with the hats on the fly. He was more excited than we were. So he has been fantastic in his efforts. And I do truly believe, with the passion that he has shown, that we have hooked into him and he is going to be with us. So we're all going to do that probably about 20 of 10. It's so about a little less than an hour from now is when that's going to culminate. And we'll get all that together
for the interview. But Eric is coming on at 9:30 Eastern Standard Time to hang out with us for a little bit.
Fantastic.
And so, we're going to talk a little bit more about the charity, a little bit more of, try to really push those donations at the end of the evening, especially. We only have 2 interviews left. We've talked to a lot of families, and Jessica's story is just heart-wrenching, and they've been a part of the charity. We've been a part of their CDH journey for many years. And I love what she says about helping others and giving back. And her family is very involved in the charity, donating time and talents. And a lot of things in the tote bags, her family, members have knitted and crocheted and so much love. And in those tote bags, thanks to families like Jessica's who send items in. We have a CDH survivor coming up next, and you saw him earlier, little Joseph, and we've known him since he was a baby, and his journey is wonderful as well. And we love seeing these kids grow. We really do. Braden, I've known his son since he was, immediately after diagnosis, right after he was born, and he's 14. Wow.
That he is.
But we love it. We love watching these children grow up. We want to see all of them grow up. That's the goal, is to have all these children grow up to someday eliminate CDH altogether. And we can do so with your help. So we have one more videotape interview coming up, and then we're going to go live at 9:30.
Yeah.
All right. So we'll see you then.
See you soon.
Share, bring everybody in.
Yeah, get everyone on that live feed so we can have that final push. So when we give our final update, we're going way past where we currently are.
Yeah. And we're going to do the shout outs as well. So if you're part of the contest for fundraising or doing the ribbons, get those numbers in, because Eric is going to do those shout outs at 10 o'clock.
That is correct. If you're not a part of it yet, you can be there quickly.
Yeah, you can. Just a big check and some hats. You want to give away some hats? All right. We'll see you then.
Hi, this is Mara Wilson from Matilda for CDH International. April 19th is Congenital Diaphragmatic Hernia Awareness Day. CDH International is the world's largest CDH charity, operating in 84 countries. 52,000 kids a year are born with CDH, and there is a 50% survival rate in the United States. Please help support CDH International's very important work by donating today on this very important day. Thank you.
What's up, guys? It's Pete Alonso from the New York Mets. It's CDH Awareness Day, so I want you guys to please, from the bottom of your hearts, find it in yourself to donate to help the kids, because there's 1,600 kids that get affected in the U.S. alone every year, and there's a 50% survival rating. I mean, that's tough, and please do whatever you can to help out these kids. As always, let's go Mets.
Hey, what's up? Size T. Right now, backstage in my dressing room at Law and Order SVU. Got my scripts, got my Scarface painting. You know, of course, Ice-T has a Scarface painting in his dressing room. But here, I'm here to talk to you guys about this very, very, very important situation that's going on. April is Global Congenital Diaphragmatic Hernia Awareness Month, all right? And I want everybody out there to get involved with this charity. It's CDH International. I want people to get involved with fundraising, just raising awareness and sharing their stories, and especially donating to the telethon. That's cdhi.org. That's where you need to go and get involved. And I always believe awareness is the most important thing. That's why I'm trying to help you guys out. Okay, that's cdhi.org. CDH International. That's what's happening. All right? Peace.
Hello, Jennifer, Joseph, and Al. We're here today to talk about Joseph's journey with CDH. Would you like to introduce yourself and tell me a little bit about yourself and what CDH or what life was like before CDH? And then tell me a little bit about your journey with Joseph and CDH.
Well, I'm Al Rohde, obviously Joseph's father. I'm a mechanical engineer by trade, and was a bus engineer and a train engineer in my pre-CDH life. When Joseph came along, it was coincidental with a switch in my career from trains to contract engineering. So the logical choice was to become a stay-at-home dad and take care of Joseph through his adventure, be it medical or school or the occasional trip to the zoo.
My name is Jennifer Rohde. I'm Joseph's mom. Before CDH, I was an air safety investigator with the National Transportation Safety Board. After Joseph was born, I was blessed with the additional title, best title of my life, of mom. And now I am the deputy chief of the Central Region, still an air safety investigator, still with the National Transportation Safety Board. Introduce yourself.
Hi, I am Joseph Rohde. I am their son, and I like to play a lot, and I like to play video games. I am 9 years old. I have CDH.
So we found out at 12 weeks gestation on February 14th, Valentine's Day, that Joseph had a birth defect, but we didn't have the details of what that birth defect was. They knew that there was something wrong. I had gone in for additional testings and scans because I was considered geriatric or old with my pregnancy, which was insulting. I didn't think I was very old, but we went in and based on a difference in thickness on the back of his neck, his nuchal translucency that was less than the thickness of a human hair, they determined that there was something wrong. And at 20 weeks gestation, we continued the pregnancy despite being encouraged to abort the pregnancy at that point. We continued the pregnancy, and at 20 weeks gestation, we saw another specialist, and that specialist was able to do additional scans and tests and determine at that point that our child was going to have a CDH, or a congenital diaphragmatic hernia. And so we continued with that specialist. We continued with the pregnancy, and a very steep learning curve, drinking from a fire hose to figure out what was CDH, because it's a little bit more common, but nobody hears about it. Nobody knows about it. And so we learned as much as we could, and continued the pregnancy, worked with multiple specialists, and were ultimately put in touch with specialists at Children's Hospital Colorado, who had a team that specialized with the birth defect of CDH and the different constellation of issues that could be associated therewith. The pregnancy was otherwise uneventful. It was stressful. It was really hard to plan for a child, not knowing what the future was going to hold for that child. Was our child going to be well, or was our child going to struggle for a while? They gave us an 80% chance of survival based on the multiple tests that they did. We went in August 29th in the evening to start the delivery process. They wanted us to deliver sooner rather than later so that they could ensure a certain team was on staff and available at Children's Hospital when Joseph arrived. And just a little bit after midnight, technically 42 minutes past his expected birth date, August 31st, Joseph was born, and it's been a roller coaster ever since. I stayed at the University of Colorado Hospital for 3 days, having had a non-emergency section. Joseph was not born naturally. I was not able to progress in labor, and he was struggling throughout the labor process. So they took him by non-emergency section. They transferred him over to Children's Hospital Colorado several hours later after stabilizing him. So the first time I got to see my son was as he was being wheeled past my head after delivery. And they had a bag on his face, helping him breathe. And we heard a little squeak just after he came out, and then they rushed him away. He had a pneumothorax during their stabilization with him. So they punctured his lung, or blew up his lung, trying to help inflate those and stabilize those. And then it was about 4 hours later that we got to see him again for just a few short minutes. And he came into the recovery room, and he was in this big box, and he was surrounded by all of these pumps and machines that were keeping him alive at that point. And it was really hard. The only way I could interact with my child was reaching through this little teeny tiny hole in the incubator and holding his hand for a few minutes before they had to rush him over to Children's Hospital. And that was the last time I saw my son and my husband for 3 days. That was almost 10 years ago, and I'm very, very grateful for technology. We had text messages, so Al could send me pictures while I was recovering from the C-section. At 3 days, the nurses at the University Hospital, don't tell anybody, let me sneak out. And they had a golf cart waiting for me. and they drove me in the golf cart across this huge parking lot to Children's, where Children's was. So it was just across the parking lot, but it was like a quarter mile. So they drove me in the golf cart across the parking lot, and I was able to go upstairs and see Joseph for the first time. And a few hours later, he had his first of many, many surgeries, and that was his hernia repair surgery. With at 3 days of life, they repaired his hernia and started the slow and frustrating journey towards recovery. So I was discharged shortly thereafter, and we lived at Children's Hospital for 5 months, 122 days, many, many, many thousands of hours. During that time, Joseph had multiple surgeries, almost daily echoes. Joseph was kind of touch and go. Initially, after his hernia repair surgery, they thought he was doing pretty good. Joseph had, as a result of his CDH, pulmonary hypertension, severe reflux, among many, many other things, but those were the big things. And it was the pulmonary hypertension, we thought, that was keeping him there. He had severe pulmonary hypertension, and so they were treating that with nitrous oxide therapy. And for many months, they tried different treatments, they added different medications, and Joseph would go through these episodes periodically where he would code or stop breathing, and they'd have to resuscitate him. And for the longest time, they really felt that this was associated with his pulmonary hypertension. At one point, they felt that it might be associated with severe reflux, and that he was aspirating, doing a silent aspiration because of the severe reflux. And so they proposed that we go through a procedure, a surgical procedure, with a Nissen and a G tube. So a Nissen fundoplication is where they take the stomach and they wrap it with the esophagus, and that precludes the migration of stomach acids and reflux food from coming up in the esophagus and then being silently aspirated, which is a problem in many of the CDH kiddos. So we went through that, and it didn't make any difference. And so, frustrated, he was eating, he was fed breast milk. I was able to express and provide him that nourishment naturally. We had to supplement with a protein powder a little bit, just to increase the nutrient content or the caloric content of the milk. But I was able to give him that, the protections that a mother's milk provides the baby. But we continued to have situations where Joseph would code and he'd stop breathing. And we were kind of at wit's end, promises that just kept getting kicked down the road of when we were going to come home and what milestones were necessary for it to be safe for him to come home. And just before Christmas, there was a new surgical doctor who took over the surgery department at Children's Hospital. And he came through on rounds one day at Children's Hospital. And it was kind of entertaining for those who were watching the conversation. But rounds is supposed to be at a teaching hospital where the specialists and the experts speak with the students and the new doctors to teach them as much as they can while they're there, and they can learn from the different patients. And it switched from the residents briefing the specialist to me talking directly with the specialist. And the conversation that Al and I were having with the specialist surrounded a bronch. And so what they wanted to do is they wanted to stick a camera down Joseph's throat and bronchial tubes and look at his lungs. And We had been told that there was a possibility that Joseph had something called tracheomalacia, which is the weak trachea. It's kind of flabby instead of fully developed. And they did not want to do a bronch with Joseph because he was so critical and so unstable. They didn't feel that they could do that safely with him. And they felt that if he did have tracheomalacia, on a scale of 1 to 10, it was maybe
it's very low.
It was very low, maybe a 1 or a 2.
No concern.
The surgical specialist was not happy with this. He said, no, I want Joseph bronched
Well, the resident
right now.
had said that he had a good night. He hadn't coded in a few days. When Mama spoke up and said, wait, he coded out this morning. So at that point, the new doc said, trach him now. So within a few hours, we found that his trachomalacia was an 11 on a 10 scale. So it's very bad. So we had a processed forward, just no time frame. So we had to go to the doctor, and we begged him, or we encouraged him that he's been coding so often. We need to have this done sooner or later, because the next time he codes could be the last time. So they have to do it now. So it was done within a day or so. So that was a great change, because as soon as he came out of that surgery, he was completely different. He was pinked up. He was more active. Codes were gone. He was no longer suffocating.
It was an aortic pexy was the kind of an experimental procedure that they did. They did that on Christmas Eve.
Yep.
Christmas Eve. And like Al said, it was night and day. When he came out of the surgery, he was doing so well that the nitrous oxide therapy that they had him on resulted in pneumonia.
It looked like pneumonia, but they weren't sure. But that night they turned off the nitrous, and they woke me up and said they're going to have to intubate because of his lungs. And then said, wait a minute, let's turn the nitrous off and see what that does. I didn't say that, but the doc said that. And the next day it was no pneumonia. He was on the mend, and within
another
month we were out. He came home
February 1st of 2012. We finally brought him home, and he hasn't looked back. So that was our birth and NICU journey, full of many blessings. And Tracy, you know this story. You're intimate with this story because you and Nicole were on speed dial. You were right there for every tear, every frustration. Nicole was my rock right there. She had been through similar frustrations. Hers unfortunately ended in a heartbreak and a loss that no parent or no family should ever have to navigate. But despite that, she was there for us. She would bring us coffee. She would bring us cookies. She would bring us tea. She would be angry with us and say it's okay to be angry. She would cry with us, and she's celebrated with us. You have celebrated with us, and so we haven't been through this journey alone. Everybody with Cherubs, CDH International, you guys are rock stars. Dawn, we got to meet Dawn at the airport. I don't remember how old Joseph was, but she made it a point to leave her boarding gate, come out, and have nachos with us at one of the restaurants there at the Denver. And so, we're very, very grateful for everything that you guys have done.
Oh, you are very welcome. You are very welcome. Joseph is a part of our Cherubs family, and we have enjoyed watching him from the little tiny warrior that he was to the warrior he is today. You have fought so hard, Joseph, and we are so very proud of you. Tell us, how was life after the NICU? Did you have difficulties with colds, respiratory issues? Did you come home with a feeding tube, oxygen?
All of the above. we are just a few weeks away from 10 years old, and we are still on oxygen as needed with colds, and then as at night he's on 1/8 of a liter, which is just a small little amount, but room air challenges at night have shown that his pulmonary hypertension is still kind of obnoxious in the background. And so as they continue to troubleshoot a couple of other help things, that it's a free safety net, you know, a little bit of oxygen, what it costs to have a concentrator, put him on it, you know, it's free peace of mind to know that that pulmonary hypertension is not going to cause problems later down the road. Feeding tubes. Yep.
Ugh.
We are a graduate from a feeding tube. Joseph had a feeding tube until he was five. Yeah, I want to say that he got rid of it. Well, we started the weaning process around the age of 5, and then by 6, we had removed the feeding tube, and then he just needed to have the surgery to close the stoma that was left over from the feeding tube. So
about French fries and hamburgers from there on.
Yep, absolutely. He certainly keeps the French fry companies. So lots of medications still to this day. We are fortunate that right now we don't need any medications other than the oxygen for the management of the pulmonary hypertension. He does do a couple of different inhalers twice a day for breathing therapies, just to help his lungs stay strong. And then albuterol with exercise or exertion as needed. We're on a reflux medication to help with that reflux. His Nissen has slowly come unwrapped, and it is currently a complex hiatal hernia. So his stomach has herniated through what's left over of his Nissen, which has herniated through his hiatus. And so it's something that's resulting in some motility issues and a couple of other concerns, some pain and discomfort with eating and activity. So something that we're monitoring actively right now. What else am I forgetting?
That's it.
Do you see the doctors yearly, Joseph?
Yeah, every with the doctor, his pediatrician, once or twice a year, and the docs at the hospital. Unfortunately, it's been a while since our last visit because of COVID. Because we don't live near the hospital unless we have to.
Right.
We have literally not left the house since March 2020. But we do go out, but he doesn't go. He doesn't go into public. He's highly isolated. It's okay, and we got you covered.
It's completely understandable. It's completely understandable. We want to protect those lungs, Joseph.
Every now and then, the hospital that's under very strict observation, and we visit the family in park. If we go visit the family, it's usually in a park or in a wide open field, so that we are protected.
Right.
And your other question with regards to colds, so, you know, one of the reasons we're so cautious with COVID is just the common cold. RSV, rhinovirus, and enterovirus have landed us in the hospital for 10 days at a time on basically oxygen support, heated high flow. We call it the spa treatment. We're encouraging hospitals to start a program similar to the airlines, so that when you're frequent flyers, you're in the hospital a lot with colds, that, you know, they start giving you points so you can, you know,
get free coffees,
free coffees, free flights.
Right. That would be nice.
So yeah, we spend unfortunately a little bit of time during respiratory season at Children's Hospital getting additional support, but we have an awesome team that has been following Joseph since he was in the NICU. We'll give a shout out to Alicia Grenels. She's the pulmonologist that has followed him since birth, basically, and she takes good care of him. Dr. Geen, absolutely phenomenal, and then Dr. Kinsella which some people know, especially in the pulmonary hypertension community, because he's the one that researched and provided the nitrous oxide therapy that currently helps so many in our CDH family.
Right. They are an amazing team up there at Children's. We have many that travel to Colorado just for their help and support and their knowledge. So those are great shout outs. Joseph, what do you like to do outside of school?
Swing set. I have a swing set in the backyard. Scouts.
Scouts, yeah.
What rank are you in Scouts?
Weeblo. Year
Weeblo? That's neat. That's very neat. Do you like trains with your dad? Do you like going and visiting in different places with trains? And
Yes.
Live steam trains.
A lot of steam trains?
Yes. Motor cars.
Very cool.
Yeah.
Is there anything else you would like to share with us, Joseph, about living with CDH, or anything that you find interesting you want to share?
Not much.
Not much? Jennifer and Al, I appreciate you taking the time today and sharing more about Joseph's story. And you both have been an incredible help to raising awareness over the last 10 years. And it's a big birthday coming up here in a couple weeks. And we hope you guys celebrate big. And you've come a long ways, Joseph, and we are so proud of you.
I know.
A long way to go.
He's going to keep you busy in the teenage years.
Yep.
Hey, we'll take it because
Okay.
10 was something that we weren't promised. So we'll take 10, and we'll take double digits, and we'll take 13, and we'll take anything that we're given the option
Triple
to.
digits.
Oh, he says triple digits. So
Triple digits. That would be awesome, Joseph.
well, thank you for letting us share our story. We're again very grateful for everything that Sheriffs and CDH International has done for us and done for our community to raise awareness, because it's sad how common it does happen, and we need to be as strong as some of the other groups are that struggle with different health challenges.
I agree, Jennifer. Thank you very much for taking the time and sharing today.
Thank you.
Hi, we are back again. And we appreciate you all staying with us for this whole day. So thank you very much. Why is half my hair cutting off? That's crazy.
Yeah, I'm gonna fix mine too. Wait, there you go.
So
We're
our
back.
tech
We're back.
support person has a lot of work to do, doesn't she? She does. Okay, so we it is now 9:20 Eastern Standard Time. So Eric is going to join us in about 10 minutes, and we are going to chat with him a bit. And at 5 till, Jason is giving us the numbers of who is the winner, so Eric can do the shout out for that. And we're really excited to tell you that we have crossed over the 20,000 mark. So great job, everyone. Absolutely wonderful. But let's keep going. We can do 25, right? We can do 20. We can do 5,000
in the last 40 minutes.
We can. That's easy. Like, I'm sure people can just write a check for $550, $500. I can't. Lowly charity volunteer here that I am. But I'm sure some people can. And can you imagine the amount of help for these kids? So it takes $10,000 to do a research grant. And it's been a while since we've been able to do that between COVID and the world has gone crazy the last 2 years. We all know that, especially families with sick kids with lung issues. It's been terrifying for the last 2 years, but thankfully most of them have done really well.
They have.
And so we're very grateful for that. But, the economy has struggled. And when the economy struggles, donations dry up for everyone across the board, every charity. So every charity is struggling. And so we haven't been able to give a research grant in a while. But let me tell you a little bit about what we do on the research side. So in 1997, we started the CDH patient registry because there was none. And we got tired of waiting. And by we, I mean all of us, moms and dads at the organization at the time. And there were only about 100 of us then. So we started the research registry on paper because this was before the internet. because the charity's that old and I'm that old. So you couldn't Google CDH back then. So it all started on paper. So we based our research registry off of a natural history study on CDH by Claudine Torfs. And oh, we have a tie for what? Okay,
we do, guys. I know. I'm sorry to break in, but just so this is a live feed, so we are breaking in right now. Mary Catherine and Katie's fundraiser are tied. 1,075 each, and then we have Luna at 1,065. So within 10 and 2 at a tie. So and then we have Jennifer jumping up to 827. So we are definitely pulling in. So out of these 3 families right now that are at that top, we're only $10 away or $5 away from falling in first place.
Well, first off, kudos to those families.
Absolutely.
I mean, wonderful. Great job. But yeah, this is going to be an exciting contest. This is great.
Absolutely.
So,
yeah. And then Colin has jumped into a little bit more of a lead for the ribbons at 113.
Wonderful. And if everyone who's watching this is going, what are you people talking about with ribbons? Like, if you go to cdhawarenessday.org, we have virtual ribbons up, and we started off every April, and there is a ribbon by the name of every child whose family gave us permission to post their name, because not every family wants their name posted. So there are thousands of children listed. Please take a moment to scroll through there. If tech support had the knowledge to scroll with you right now, we would. Tech support does not.
We are out of tech support.
Tech support doesn't know how to do that.
Yeah.
It's new software. Tech support's lucky we're here.
Mm-hmm.
So, but next year we will know how to do that. And if you scroll through the names, thousands of names, it's a very somber reminder of just how many children are affected by CDH. And if you haven't absorbed the fact that all the celebrities have been telling you all night long, 52,000 children a year born with CDH. So with the research registry, when we started it out in 1997, we took a published research article on CDH that was done statewide in California. And that was done in the early 90s. And there's not been one since. We took the information from that. We built our own registry on paper. So on my living room floor, we were going, 1 survivor, 1 female. It was not HIPAA compliant. I'm just being honest with you. I mean,
HIPAA didn't exist then, so you're okay.
You're I'm the only one who saw it. So it's not like it was shared information. But, however, we've never had tech support, honestly. So that's how we started. And now it is the world's CDH patient registry, and it is very compliant. It's GDPR and HIPAA compliant, and we work with surgeons. We work with Columbia University in their genetic study. We work with Mass General. We work with Toronto, the Zani lab. We work with the Utah lab with Gabrielle Cardone, and we work with everyone. We're in the middle of so many research projects because that research, we're so proud of this registry because the patients own it. We haven't outsourced it to a company who's going to sell our data. Patients can go in and update their data, and they can remove it if they ever decide not to be a part of research. That research works with the Surgeons Registry. You saw some video earlier on from Texas with Dr. Matt Harding talking about the CDH study group, which is, I believe, 90 CDH hospitals around the world working together, collaborating with their data, their surgical data, the neonatal data, and then we have natural history data. And what that means is we have family history. We have pregnancy exposures. We have long-term medical history of these kids that the parents input themselves. So it's ongoing. So when these kids are out of pediatrics and the pediatric surgeons no longer follow them, don't have any information, we do, because the parents keep putting that in. And then genetic research from all of these amazing labs. And so a lot of our research funding, instead of research grants, has gone into making this registry work, and it's live and it's working, and we're collaborating, and we published in 3 medical journals last year, which is amazing, including the Lancet. We were published in the Lancet, and I'm going to shake my head because that's awesome. Because who would have thought this little charity that could was part of research in the Lancet. So we're really excited about that. And we have so many research collaborations going on that we're not public with yet because you don't talk about your research until it's published. Ever. That's the thing. You can't do that. So you're going to hear a lot more from us. And But it all takes money. It takes money to make sure it's secure. It takes money to put it on a server. It takes money to advertise it. It takes money to hire people to run it. It takes money to reach out to the families, to do Facebook ads and Google ads, and to just spend time to contact each one and talk through it. And just, we're so happy it's up and it's live, but it still costs money to run. You know, nothing is free in this world, unfortunately, including saving babies. So, but we're really happy about that. And on the plus side, our registry is the skeleton for the gastroschisis community, for the valvular community, for the tracheoesophageal community, and for other like birth defects. We're giving it away to them, not the data, the skeleton, so that they can adjust it for their patients, so that they're not starting from scratch on their living room floors like we were in 1997. Because if you can achieve something and lift other people up as you do it, all the better, especially children. So not only are we helping CDH kids by the thousands, but we're helping hundreds of thousands of other children doing this. And that return on your donation is just priceless for that.
And that information you could fill out as a parent of a CDH survivor or angel could be the key that is needed in the research to help break through. Because we are our DNA, right? And our children are a mixture of your significant other. And if they could find that one piece that's been missing and they're like, I think I've seen this, they go on to the next one and then the next one, and then they circle it and they find it in 100 and 200 and 5,000 people, then they can narrow it down. These folks like Brooke, a CDH survivor, can find these things. So this information is more than just you filling out some questions. This is the life information that we need to be able to hand to our researchers and say, I think we found it. And we found it because our families filled out the registry that Dawn started on her floor with a piece of paper and probably checking tirelessly to get it done. So we need your information, and that's power as well. Information is always going to get us the results we need. So the more families that can fill it out for us, for yourselves, for your cherubs, the better we will be in the long run.
Yeah. And for donors out there in the public, we're moms and dads, but there's power in numbers and in dedication to save our children. But we're also professional, despite the technical issues for tonight. Our research collaborations are with Harvard and Columbia and the University of Toronto and the University of California. And we know what we're doing, except for tech support. We do know what we're doing. And we present our own research, and it has been published, and we collaborate with the best in the world because we've been doing this a very long time. Because as moms and dads, we know what research needs to be done. Our focus is a little bit different than the surgeons and the geneticists because we live with CDH every day. We know these children. And by funding research grants, we're able to help point research to where we need it to be. Mm-hmm. And these CDH is showing up on 100 different genes, 100. It's not like Down syndrome and you go, that's it. It's not like CF where you can go, that's the gene, or we can just do a blood test and know that's cystic fibrosis. CDH is stealthy. It shows up on 100 different genes. So it's taking us a little bit longer to figure it out. But working with amazing minds at incredible labs and universities, we're so close. We're so very, very close to finding the cause of CDH. But that takes money. It really takes money because what we do out of love, and a lot of the researchers do out of love too, they also have to pay the bills. Mm-hmm. Research is not free. They have to hire people to do the research. And so our voice is as patients and parents is funding research and our data. So we are really excited about what we're doing on the research side, but there's a lot more to do, and every single dollar helps to fund it. And because we've been doing this for so many years, we know what to fund. We know not to just write a check to anyone. We know what needs to be funded. We know because we're there at the conferences. We know these surgeons. We have had long-term relationships with them. We know who's researching what, who's doing what, who needs funding, who doesn't, on a global scale, not just the U.S. And we don't work with one specific hospital on purpose. We never refer families to one specific hospital on purpose. We are global. We care about all the children at every hospital in every country. We want what's best for all of them on a global scale. So And we're working with the WHO and NIH, and I'm on far too many committees, far too many committees. But as we said to Eric earlier, we walk through every door that opens for these kids. So every donation dollar helps. And we're really excited now that the world's waking up a little bit and people are getting back to business, even though the world's still crazy. But all through COVID, all through every awful, horrible thing that's happened globally in the past 2 years, our children are still being born. They're still sick and they're still dying. And we are not going to let them be forgotten. We're still here. We're still screaming.
With that, we are.
Yeah.
Still making phone calls, still asking for support, still asking for your help. We're still asking for partnerships with companies that want to partner with an honest organization that has a very singular goal, and that is to eradicate CDH.
Yes.
So our goal isn't going to change. If you come to us in 5 years, Dawn and I will still be here. Hopefully there's tech support doing what we're doing today, but we're still going to be here. That is one thing you can bank on. CDHI will be here, whether it's on our backs or us helping row the boat. Either way, we're going to be here. And we need that partnership with sponsors to help get there, whether it is directly affects you as a company or as an individual or not. Imagine being that push, that final piece that helps us get that result, where you can say, I was in on that. I was on that ground floor. I helped raise that last awareness. We did that last research study that we got that grant taken care of. Our last picnic, we raised enough to do another grant, and that grant's the one that did it. That's a huge thing for you, for anyone to be a part of that. I know Dawn might fall over if that happens, and I'll revive her and bring her back, because tomorrow is another day that we got to keep fighting. Dawn will be there either way. I don't have to revive her. She'll come back pretty quick. But we need it.
You will have to stop me.
Yeah. Well, our goal is to slow Dawn down at one point. So, but she's never going to slow down. And that is because, as she has pointed out several times, and Haley probably said it best in an earlier interview, she's a mama bear and always will be, and she will never not fight. So these babies have a voice when they don't have a voice. And, if we can get to that point where we know where we're going, we're not stabbing in the dark anymore, but we're still feeling on the walls. We just need to find that handle, and we need your assistance. And remember, who is more important than anything else. We're one contact away, as Eric pointed out earlier. You're always one contact away from that huge person that can push you in that direction.
Yeah. Absolutely. We haven't talked enough tonight about corporate sponsorship. I'm tired.
We have not. Yes. We have been at this, guys, for just shy of 12 hours.
Plus, we haven't slept all week.
Yeah.
Because even though it looks like we don't know what we're doing tech-wise, we've been working for months, really. But
it's hard work to not look like what you're doing, which was what we're doing now.
It really does. It's the first time with our software this year, but we love it, but it's a learning curve. But with corporate support, maybe you can't donate as much as you want to, but you work for a company who runs a chain of restaurants around the country, and they can share CDH Awareness Day on a scale that we can't. Or you work for a company that sells tennis shoes, and they can do a CDH awareness shoe. Think about your own network and the reach that we can help these kids, because it can be absolutely astronomical. And also on a global scale, we're registered in 7 countries. We're the only charity in the world of this scale for CDH. We're registered in the United States, Canada, US, Singapore, Hong Kong, Netherlands, and the UK. So donations and sponsorships in all 7 of those countries is tax deductible. And we're adding more countries because we work in 84 countries. And we don't need sleep, apparently.
It's optional.
Yeah.
It's optional.
Because, it's not about one child or one hospital or one country. You've not heard my son's name this whole telethon.
Yeah, CDH doesn't matter where you're born.
No, it doesn't matter. And we want to help all of the kids. And so I'm a mama bear, but not just to my son Shane. Thousands of kids. And Dave's papa bear to thousands of kids, because his job is raising money to help these kids. That's what he does here. That's why he's here with me, because he's awesome. And everyone at the charity is about all of the kids. It's not about anyone showing up just to help our child, which is a wonderful thing. Don't get me wrong, it's a wonderful thing. But the focus is bigger because there are a lot of families who can't, they don't have the platforms that we do to go on Facebook and do lives or all across the internet and to have wonderful celebrity guests. So we're speaking on behalf of every CDH patient when we're here tonight. And so we have so many wonderful things that we're going to do, that we have been doing, that we need your help to continue doing, and so many kids to save, because 50% survival rate's unacceptable in the US, in a first world country with medical technology we have. And 50% is every child included, those whose parents choose to terminate, those who die before they're born, those who don't survive transport, those kids who don't survive surgery. All those children who are not counted are counted at CDH International. Every single child diagnosed with CDH, every adult diagnosed with CDH matters to us. And so we want to help all of them. And I could talk about that for hours. I can get long-winded because this is what I love. I want to help these kids, and you want to help these kids. And I know you out there want to help these kids. So go to cdhi.org/donate. Donate.
Absolutely. We need you as much as you need us to be your voice when you can't be. So please, definitely, the Angel Club is our best way to help us on a consistent basis. And remember, whatever you can give per month, we will take, because we will stretch that dollar into $5. And that's just the gift that we have at CDH International. So please, if you can give more than $1 a month, that would be amazing. Angel Club, like we had said earlier, is a safe, secure place off cdhi.org/donate. It's super easy to do. And once it's in there, it's done. You just know every month it's coming out, and we turn that into the right section that we need to go in. And like Dawn had said, we know where and who to back. As Dawn is on a plane going somewhere tomorrow, her contacts, she's not just walking in and meeting a new doctor and going, hey, you want $10,000? We would love to have that problem. But we have to make sure we're putting this money that you guys have so graciously donated to the best work it can do, and the research and everything else. And that's where we're heading. Today has been an amazing experience. I know we're just waiting on our final groups to join in. Remember our little firecracker end there with bringing on a live story at a light up in California, and Eric as well. So we're just waiting for them to jump on so we can bring that live to you. So now is definitely the time to get as many people as you can to join on to our feeds so they can to see this. And, don't hesitate. You have somebody out there that you're like, I really think they would love to donate, but I can't talk to somebody. Reach out to me. I'll talk to them.
Dave's email address
is
david.holt@hi.org. Yes.
Please do. I will sit there with you, hold your hand, talk for you, talk for these children as I already do. We are absolutely here to be the voice for you. It is the gift that I was given to not fear that. So let me use that for you. I would love to be that voice for you.
I typed in Dave's, but mine came out because I was so used to typing my own. So in the comment section below, please email Dave for your fundraising needs. Yes.
Absolutely.
Yeah, I'm just on autopilot.
Yeah, we're on autopilot at this point. Yeah, we are definitely trying to get into the final bit there.
Yeah, so we've got messages flying back and forth for our team who are working overtime. They're volunteers anyway, and they're just...
There is no overtime when you're a volunteer, I can tell you that, folks. But we are volunteers, have been with us since we started, and they all have full-time jobs too. So I know that it's a big deal. I don't even look at today as a day that I was here. It is something that I know my wife and I are very passionate about, and I am the loud one of the group. So I have always been the speaker. My wife is far more eloquent than I am. She knows way more about all this stuff than I do, but I don't have any hesitation to, go ahead and be the one on the microphone. So that is definitely something that I have to give back, and that's why we are here.
Yeah. And we still have messages flowing back and forth. You're going to see me doing things because I am doing tech support. And let's see. There we go.
There
Hi
he
again,
is.
Eric. How are you?
So good. So good. Good to see y'all.
Absolutely. It is good to see you. We have made it to that final run.
I was just going to say, you hanging in there? We're in the home stretch.
We are. And you have been with us since early this morning, and we are so gracious.
And I'm just texting our family who's coming in. This is the first time they've done something like this, so we're trying to pull them in. And we're hoping it's going to be dark enough in California because it's only 6:42 there. So hopefully things are lighting up.
Yeah, no kidding. No kidding. Well, I'm really looking forward to talking and getting to meet this family. How many are in the family?
Honestly, I don't know.
We're not sure how many she brought to the light up with her.
We don't know. It could be the whole neighborhood, and I hope she did.
It could
More
be.
the merrier, though, right?
Yeah. But right now, I'm going to forward you the winners of the ribbon contest, Eric, so that you can do a shout out for these families.
Incredible. Yes. Okay. To my, you'll just text it over?
I'm going to text it right over to you. Yep.
Perfect. Perfect. I know there was quite a few that were really making a difference, and it was kind of neck and neck for a second.
Then we had a tie at one point, literally did $1. So we'll see. We'll see if someone can make that final ribbon push and get over.
Wow.
Yeah.
Congratulations to everybody who was, involved and, kind of made the biggest impacts there. So I'm really excited to see these names and read them out loud to y'all, and just give a big old special shout out because there's nothing cooler. Here they are.
Here they are.
Would you like me to do the honors now?
Go right ahead.
Go right ahead.
Okay, our ribbon winners are in first place. Well, you think I should maybe start below
Wherever
and
you want. Yeah,
work
maybe
our way to the top?
Yeah.
That's fine.
Okay. In third place, in honor of Alicia Bold, 100 ribbons. And in second, in honor of Olivia Catherine Case, 101 ribbons. Got them by one ribbon on that second to third place. And in first, our ribbon winners, in memory of Colin Matthew Scott Ingham, 113 ribbons.
That's amazing. That's absolutely amazing. They're incredible families too. They're very involved, and Colin's mom has been doing our helping to do our Instagram reels all day. So thank you, Tina, for that. So she's volunteering and she's doing ribbons at the same time. So
thank you, Tina. That's incredible. We really appreciate that. Yeah. And I mean, I'm looking at these numbers and I'm like, why? They're really, they were close. All three of them were really close, and they all did a great job, and just so cool. So big old shout out to all three winners, and that's something to hang your hat on. That's pretty awesome.
Absolutely. And I know we're waiting on the final
campaign
winners for the total donations, and we're trying to give everybody the last possible minute to get those in, so we can get those winners. I think our cutoff is 10 more minutes, folks.
Okay. Tracy's gonna get this to us, and so Francesca is at the sales of lights in San Diego, and she's going to be with us in just a second. She's navigating the software as well, so she's going to come on in and share her story with us, and then we can see the lights light up. And then I think that's a great way to end the night, and also to announce the other three finalists for the donations. But Eric, we made the 20,000 mark, so we hit that goal, and we went past it a little bit. We don't have the final total yet, but we're excited. We're happy. We're going to be able to help a lot of kids with that, and so it's a good day. It's a good day.
Absolutely incredible. That's a great day. Oh my goodness.
Yeah.
I mean, so Very, very happy to hear that. That's
Yeah.
fantastic. Thanks to everybody who's donated, and help spread the word to get more donations in other places. It really is just, it's been such a group team effort here, and everybody's been so awesome. So to hear those numbers makes me really happy. Really, really happy. I haven't seen a picture yet. I was really looking forward to at some point. Maybe they haven't posted them yet. I got to see this castle all lit up. I just haven't stopped thinking about it.
We have a lot of castles lighting up, actually. I'm sending Francesca a thing. That's why I'm looking at my phone to get the link to her. And so I'm having to type this up a bit.
Yeah, you do your thing.
And
while she's typing, I'll talk so she doesn't have to try to talk, type, and stare at the screen at the same time.
Yeah, but you don't know about all the castles.
I don't.
All right, so then you type.
Oh my goodness! Yeah, here I will type. Yeah.
So we've had castles light up all across the UK, and bridges light up everywhere. Buildings in London lighting up, all over Ireland lighting up, because I really push for Ireland because I have an affinity to it since that's my name. So I really love the country. But we have charity status in the UK, and that's one of the charities one of the countries that we work in. And everyone's been phenomenal. We have a lot of light ups in Scotland, which is incredible since the CDH conference is in Scotland in just a few days. So we'll be there. And we're very grateful the surgeons didn't plan the conference at the same time as this telethon and Awareness Day, because that would have been a bit much. But I do hate that I'm going to be missing those light ups that are going to be there in just a few days. But we have Blarney Castle in Ireland light up for us last year. The Eiffel Tower light up for us. We
got to get Empire State Building. Has that been done yet?
They deny us every year, Eric. We try. If you have a connection to the Eiffel Tower,
Empire State.
The Empire State Building. Yes, if you have a connection to the Empire State Building, please let us know. And Niagara Falls, both sides, Canadian and American, light up for us every year. And Francesca is here, so we're going to add her in. I'm not sure how the overlays. There we go. That's much better.
Hi there. Sorry, it's extremely loud where we are.
That's okay. That's okay.
They have a concert going on right over there too.
Oh gosh.
Incredible. It's good to see you.
Hi, how are you guys?
We're good. We're good. So it's still light there in California, which makes sense.
I know it is. Yes.
It's okay. That's okay. You can zoom in for us in a bit. But for right now, tell us about your story. Tell us why being there is so important to you and raising awareness is so important to you.
Well, when we found out our daughter was born with a congenital diaphragmatic hernia, CDH, it was just unknown to us. We didn't know anything about it, what to do, what was going to be expected. And once finding out about CDH International, it just exchanged share-ups. It really made us part of a family, knowing like we're not alone, we're not the only family out there, and kind of like what to expect and just more details of it, because there's not a lot of doctors that can tell you a lot and you don't really want to search too much on the web. So going to CDH International was great. It was great and really helped us through our journey in the beginning with our daughter.
Wonderful. Wonderful. So tell us a little bit about her journey with CDH.
So she was born 10 years ago on March 16, 2012, with a left side CDH hernia. And she was full term. We had no idea, again, that she was born, that she had CDH, so it was unexpected. After she was born, we stayed at Kaiser, the hospital, for about a week, and then her stats weren't going up and her oxygen levels weren't coming up or anything. So we were transferred at that point to Rady's and a possible candidate for Ecmo. After being at Rady's for about another week, 7 days, they decided she was a candidate for Ecmo. She went on Ecmo for 14 days. We had a nice run with that, no blood clots or strokes or anything of that nature. So it was pretty good with the Ecmo run, being on life support. After that, she just started to get better, and she got ready for surgery, and surgery happened and things just progressed to get better. But it was a a long 104 days is how long she was in the hospital. And it was, best way to describe it, like we always say, is every day's a roller coaster. If there's ups and downs and you just don't know what to expect. And we survived it, and she's here with us now, and she's actually right here.
Oh, let's see.
And as happy and as good as could be.
Hi, Francesca. Their mom and daughter both named Francesca. So,
Okay.
Yes.
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 So beautiful.
Yes. My mom is also her name is Frances too. So yeah, you can come over. Just not with
She's like,
that.
no, don't want to get on there.
She's 10. So
Come on down, you can't.
Her mom wants to come on. No, mom.
That's another Franny. Another Fran.
Hi there.
So
Long haul. It was a long time. Long time. 4.5 months is a long time. But
That
she
it is.
survived, and she's doing great now. And we got strong parents here. I'll tell you that. A lot of support during it.
Yeah, I see a lot of love right there in that frame.
Yeah.
That's beautiful.
So, little Francesca, can we ask her some questions?
Yeah, absolutely.
Hi. So, what grade are you in?
Fourth,
Fourth. What's your favorite thing to do?
riding my bike.
Wonderful. Do you like sports or art, or what do you like to do?
I like art.
So, have you met any other kids with CDH before?
No.
No? Well, we've got to fix that.
Yeah, we definitely
We
do.
have to fix. There's a conference coming up next year. We have to figure out a way to get you there. Yeah, so you can meet other kids, because you're pretty amazing. You are. Thank you for talking to us.
You're welcome.
Great.
She's adorable.
Thank you. She's got baby brother here too. Giovanni, you want to say hi?
Hi there.
Hey, buddy.
Look, you can say you were on Facebook. You can, tell your friends.
Right? He saw us once we were in the newspaper, in our local newspaper, and he's like, "We're famous."
Well, hey, this is streaming, so I mean, come on, and look, we're the least famous person in this video right now.
Yeah,
So
you just met
I mean,
celebrities.
yeah, absolutely.
Wow. Well, we are so grateful that you're doing this. That you agreed to because we had filmed your interview, and that's going to be on YouTube, so everyone can watch the full interview. But we're so
Fantastic.
grateful that you have agreed to talk to us live and let us be there at the lights. And this is our first. What is the news term for this?
This is
On location.
Yeah, on
On location reporter.
Oh, please. I know.
Absolutely.
Got helicopters flying in over here. Hold on.
That's okay.
That's okay. Hey, they need to fly. You never
It's
know
just
what's
a-
on the helicopter.
Just a Black Hawk.
Our kids have been on.
Yeah,
this
our kids
helicopter.
have been on this helicopter, so you never know, right? That is crazy.
Well, I wish it was dark already so we could see it light up for you guys.
That's things are not in our control, like daylight.
Hey,
I know.
Where is it happening? Is it happening behind y'all, or which building
Yes.
is getting lit up?
So these are the cells right here. I'm actually on the back side of the building, and I'm hoping that both sites will be lighting up, because not just the front, I'm guessing it's going to be completely over the top like they sent to us in the photo. So I'm extremely excited. This is the first time they're doing it for CDH awareness. I tried to get it on some news, but I guess I was a little bit behind. So better luck next year. We'll go again. But yeah, so all these tents will be lit up. It'll be great. They've got a concert going on right over here. So a bunch of people that are here. Also, you've got Pepco Park on the other side. So a baseball game that we'll be going to.
Wow.
So all those people will see.
Exactly. So next year I'll plan better and maybe get the Petco Park to announce the lights, just so everybody can find bring more awareness.
How about CDHI in fireworks exploding above there next year? I think that works out extremely well for awareness.
Not our budget right now.
Well, we're going to get there to be in our budget. That's what we're here for. That's what we're here for. Us
Yes,
Eric has been
a
with
lot
us
can
for
happen in a
all
year.
day, so we can have big budgets to do those awareness things.
Yes.
That's incredible. So what is the building that's going to be lighting up that's been so gracious to do this for us?
It's the San Diego Convention Center.
Wow. Amazing. Big
Yes.
shout out to them. That's awesome.
Absolutely. A big shout out. Awesome. Very happy that they're doing this.
That is amazing. They've held a lot of conferences for pediatric surgery and pediatric medicine for our kids in the building. I've been in that building many times myself. I wish I was there to see it light up. I think it's wonderful.
I'm excited.
Inside
I'll
and
run to the
outside.
front if I have to.
Well, please send us video later and we'll put it all over
Absolutely.
social media and photos, and definitely want photos of your family in front of the building lighting up too.
Absolutely. You got it.
Well, Francesca, thank you so much. Eric,
Thank
do
you
you have any
too.
questions for them or?
No, I can't stop smiling. I mean, just seeing the beautiful, happy family. And, I've got 2 kids. I've got a boy and girl of my own. And so I understand all the love, and, she's just beautiful, and to see her healthy
Thank
and
you.
happy.
Nice to you.
It really does. It warms my heart. So I hope you guys have a great night.
Thank you. You too.
Thank you
Thanks,
so much,
Francesca.
Francesca.
Thank you so much for having us. We'll send you pictures.
so
Oh, sorry.
See ya.
Guys, I say bye. Say bye. Bye.
Bye, everyone.
We'll see you. Bye.
Absolutely. What a beautiful family. Absolutely beautiful family.
Truly. That's incredible.
We had the fundraiser contest people lined up. Tracy sent me that information. I'm right now, Eric.
They gained an extra 3 minutes.
They did. They did. I hope they.
So hopefully somebody had that last minute push.
So there they are. You should have that in your phone.
Okay, let's see here. Wonderful. Yep, fundraisers. I'll start at the top this time. Why not? We'll flip it around.
All right.
First place, Katie Steklisas, right? I hope I said that right.
I don't know. Katie. We're just calling her Katie.
Katie S's fundraiser for CDHI in memory of Randon. Am I listing the number, the total?
You can. Yeah, you can. That's public. Yep.
$1,125.
You go, Katie. Great
Katie,
job.
thank you, Katie. I'm so sorry. I'm so bad with pronunciation and names. I just didn't want to butcher it on live. Thank you. Congratulations. Second place, Mary Catherine Kaiser Nips found fundraiser for CDHI in honor of George for $1,075. Absolutely incredible. Thank you, Mary. And third place, Luna's 10th birthday fundraiser for CDHI by Danny's Diaz for $1,065.
That's absolutely
amazing.
wonderful. And I want to do an extra shout out to Mary Catherine because her family creates these beautiful CDH awareness bracelets and donates them to all the care packages for our families. And so they ship them to us, and we work together with them. And they're a lovely family. But all of these families, congratulations, Eric. Thank you for being with us all day, and for caring about these families and being so wonderful. And just really, we could not be more grateful. We could not have picked a better co-host for today. Thank you.
Well, thank you guys. Thank you. And there were some incredible milestones reached today. And if anything, we reached a lot of new people, and all over the world. I feel like there was a lot of just awareness brought, and we built a bigger, stronger, and a community that maybe wasn't there yesterday, that we got to kind of bring all together today. So it was absolutely incredible. And I'm determined this time next year, I want you tell me what building in Fort Worth, Texas, and we're gonna have it lit up.
Deal.
That
I
works
think
for us.
that'd be
Absolutely.
great, and I'd love to be there and be able to do live on the scene like our friends over
Yeah,
there.
absolutely, absolutely.
Absolutely. We will definitely do it. If you're not on site filming somewhere else, which we'll figure
Yes,
it out.
that could be a thing. In which case, I'll make sure somebody else is on site, but the building nonetheless will be lit up.
Yeah,
Yeah.
absolutely.
And-
We really appreciate you had the opportunity to jump on today, and not only did you do that, you did it 7 to 9 times, and that's amazing. Not that the cameos from the other celebrities aren't there as well, but you had that opportunity and you saw it, and you brought your son on, and you connected, and I feel like and I know Dawn feels the same, that you're a part of CDHI, and it was that quickly you were just right there with us, and you were as excited as we are when we came up with crazy ideas out of nowhere, and you were just as excited to be with Francisca as we were, and that's an amazing thing, and I thank you as a father of a CDH child, and my wife and I, and Braden, I'm sure somewhere thanks you from there, and thank you for your time today.
You are so welcome. You're so welcome. From the bottom of my heart, thank you all for what you do for these families and children all over the world. And only the beginning, as we've said a few times, only the beginning. And I'm excited to, keep taking this journey with you guys.
Thank you.
Absolutely.
Yeah.
And off air, we can hear about all the next projects. Never mind. I'm just
Yeah, we're both fans. So
yeah. Been and watched and just waiting to see that refresh button. And that's all we're waiting on.
Oh, man, that's awesome. Well, thank you guys. That really does mean the world to me. And I'm excited to be
even bigger fans after today.
Oh,
really?
Absolutely.
Yeah.
Within the first 5-minute interview.
Oh, well, that's, I found myself every time I'd leave, I'd run. My wife is inside, and I'd run and I'd tell her everything. I'd be, babe, can you believe people, they lost funding for this, and people aren't doing this, and nobody knows about this. And I just felt like I had so much I was telling her. So I feel like her brain's probably like exploded today from everything I've been telling her. But, we'll have to get her on next time as well. Cause
we will. Absolutely. But like you said earlier, one person away. That's all we are right now.
Yeah.
And with your help and every family's help today and all the thousands that we've raised, we're one away. Next year, we could make this telethon look like, can't believe we sat there for 12 hours. And this year, we have that destination now.
Yeah. Well, we'll do longer next year. We'll do whatever we have to. But the enthusiasm that you've had to help complete strangers' children all day long, if we can multiply that by 1,000 people, 10,000 people, 100,000 people who are watching and touched by CDH raising awareness, we can save these kids. We can. We absolutely can. And so thank you. Thank you so much. Thank you to all the families who opened up their hearts to share their stories, because it's not easy reliving those journeys. It's really not. It takes so much energy out of you. And they did that to help raise awareness and to keep some of them to keep their children's memories alive, and others opened up wounds when they have survivors and to relive that, to raise awareness, to help other kids. And some researchers came on today as well. And none of it's easy for anyone. And everyone did this just because they want to help. And so we're so grateful to everyone who contributed, fundraised, shared a post, came on, helped us host today. Thank you to Dave for putting up with all my insanity all these weeks.
No, we would be here another hour if I would give Dawn the due she has deserved.
Oh, no.
So I know she doesn't want it. So I'm not
team.
going to give it to her, because she's going to kick me under the table like my wife would probably, to stop talking at this moment. But we would not be here if it wasn't for the efforts. The technical efforts, let's put it to you that way. Tech support, Dawn, we did not have one hiccup. One video hiccup was all we had, but the audio played. So it was a win-win-win.
Eric carried the telethon for us.
That's the natural entertainer in him. He saw the opportunity, checked to see if we were alive, and said, "It's mine," and started talking. And it was an amazing experience for him to see that opportunity. I think he looked down and said, "Well, they're not there, so I'm going."
Yeah. So all team, the great team effort all across the board. 3 of us, all the people behind the scenes, all the families, all the donors. Thank you all very much. It's been a wonderful CDH Awareness Day. We'll see you all before next year. And thank you all again.
We'll get those hats ready for you, Eric.
Yes.
Oh, I can't wait to sign those babies. I cannot wait. And hey,
Absolutely.
safe travels to Scotland. Can't wait to hear about how that goes.
Yes. Yeah, we will pass along that information to cdhi.org is where all this information is available. And we are always there to help.
Yeah.
Thanks, guys.
We'll be talking to you soon, Eric. Thank you, everyone else. Have a great night. Happy CDH Awareness Day. Take care.
Thanks, Eric.
Bye, everybody.
See ya. All right.
There goes my heart beating, and you are the reason I'm losing sleep. Please come back now. There goes my mind racing, and you are the reason that I'm still breathing. I'm hopeless now. I'd climb every mountain and swim every ocean just to be with you and fix what I've broken. Oh, 'cause I need you to see that you are the reason. There goes my hand shaking, and you are the reason my heart keeps bleeding, and I need you now. If I could turn back the clock, I'd make sure the light defeated the dark. I'd spend every hour of every day keeping you safe. I'd climb every mountain and swim every ocean just to be with you and fix what I've broken. Oh, 'cause I need you to see that you are the reason. Come back, you are the reason. Just a little closer now. Oh, get closer. I need you to hold me tonight. I'll climb every mountain and swim every ocean just to be with you and fix what I've broken.